do you want me to stand right?
Good morning. We'll call the Kaneohe County Board of Commissioners meeting to order. First order of business is to stand. We'll say the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Dale, how did you recite that?
I tried to do it your way, but it doesn't feel right. Sorry.
Yeah, he's faster than us.
Yeah.
Well, there's a story behind that, which I'll
Okay.
tell a different time. Good morning, everybody, and thank you for being here. Those that are here in person and are going to present, and for those that are watching, welcome. We appreciate everybody being interested in county government. Today, we have the first item on our agenda is what we call the consent agenda. You all received your packet and the items that are in that packet. The consent agenda items are the approval of the minutes from last meeting, the approval of the auditor's warrants and claims, the approval of the human services warrants and claims, the Minnesota Family Investment or MFIP biannual service agreement, and then the Supplemental Nutrition Assistance Program or SNAP Joint Powers Agreement. Is there anything anybody wishes to pull from the consent agenda? If not, I would entertain a motion to approve the consent agenda.
So move, Mr. Chair.
Commissioner Gardner moves on the consent agenda. Do I hear a second?
I'll second it.
Commissioner Dale Anderson seconds. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Under general business discussions, Woodland Center's annual update. Dr. Chose, welcome.
Thank you. Hi, folks. So I'm Dr. Chose. I'm the executive director at Woodland Centers. I just like to come every year and present to all of you, let you know what we've been up to, answer any questions you have about us in general or mental health, substance use in general. So please ask your questions. I did give you guys information. Did you guys get the handouts? Okay, perfect. So talking back to data from 2022, it feels weird. We're almost to 2024, but we're talking about data for 22. In 2022, we served 4,716 individuals across our entire
Dr. Chose,
region.
could I just stop you for a brief second in case we have people that have never sat in on this and we made today? Could you give a real high-level overview of what Woodland Centers does and what your role is at Woodland Centers?
Thank you. I always skip over those pieces. So I am the executive director at Woodland Centers, but I'm also a licensed psychologist by training. I've been the executive director since 2016 and was the clinical director before that, and then a psychologist on staff before that. Woodland Centers is a certified community behavioral health clinic, CCBHC, which really means we provide a wide array of mental health and substance use services across a 7-county region. We serve all ages, from really womb to tomb, and try to provide all the services we can, not only for their mental health and substance use needs, but trying to also, under CCBHC, try to be more understanding and caring and thinking about the whole person. So how can we help them get their physical health needs met? How can we think about their housing needs, their safety needs, their food needs? We might not be the one providing all those services, but we help make those connections in our community. So thank you.
Thank you.
Yes. So last year, 2022, we served 4,716 individuals across our 7-county region. 87% of those were from our 7 counties. We do serve individuals across our entire state. I believe last year it was 56 different counties people came from. And some of that is through our mobile crisis services. If people are in our catchment area, we serve them. They might come to us to our residential crisis services. So we do serve a lot of folks, but this also breaks down the percentage of people by county. So 44% of those that we served were from Kaneohe County. Of ages we served, as you can see, pretty wide range of ages. So last year we served between the ages of 3 and 88, but we have served individuals as low as 1.5 and people in their 90s. So again, we serve everybody regardless of age. About 31% of those that we served last year were under the age of 18, and we continue to see that number rising. When we look at the last kind of column on that first page, the 2022 clients served, I wanted to break it down here too because we have our purchase of service contracts with all of our counties. And this really shows you all of the clients served in the county and how many of those fell into that contract because it pays for only certain services on that sliding fee scale. And so for Candiway County, for example, we served 1,779 individuals. Of which 547 were under that purchase of service contract. So about 69% of those that we served were outside of that contract, which is services we provided fee for service. And in the county, for Candiway County, we provided almost 33,000 services last year. A lot happening.
Dr. Trost, if there are questions, would we prefer you wait till?
Anytime, no,
Does anybody have any questions at this point? I had one, so
I have one.
Yes.
So you said you provided almost 33,000 services. Could you give kind of a broad
Of what all
range
they
of
might
what,
be.
what, I don't need all of them,
Yeah,
but some of them.
So Candiway County is where we have just the breadth of service because our biggest office is here. So we have therapy services, we have medication management services. That would be our crisis services, or residential crisis, but also mobile crisis. And we'll talk a little bit more about mobile. We have day treatment services for youth and adults and adolescents. We have substance use program services, which is outpatient. So they come to us 3 days a week, do 3 hours a group at a time, and then go home. What else? We have ARMS, so adult rehab. We have school-based mental health services. I know I'm missing some. We have assertive community treatment services, so really intensive services in the community for folks that have severe and persistent mental illness. So that's a few of them, but it's a lot. Yeah, it's a lot of different categories. Yeah.
All right, thank you.
Yes.
and my question was, you mentioned 87% and are from the catchment area, and the catchment area is 7 counties or?
Correct.
whatever?
7 counties. Correct.
Okay.
Yep.
And so the 13% that are not in the area, do they pay the same rate as somebody in the county? And how does the charge, is it the same as if it was a private practice
Great
practicing?
question. Yeah, so we have a sliding fee scale, and we do offer that to anybody coming through our doors as a CCBHC. We're required to do that. However, your POS dollars that apply to that only apply to people in Candiway County. So we are really careful about that. So if somebody's coming in sliding fee scale, that's Woodland Center's cost that we take on. So if they're from McLeod County, for example, and they come get therapy services and they hit our sliding fee, we take that hit for the reduction in the cost. But most of our services, about 75 to 80% of what we do is Medicaid. So it is straight billing, and we get paid for the service. So a lot of it is just billing out the service that we do, and then we just get paid whatever the insurance company agrees to pay us. As a CCBHC, we have one rate that we get paid for all Medicaid services, and that's an advantage of being a CCBHC. Yeah.
Thank you.
Yes. So the next page is our mobile crisis data. This is, I think, important for everybody to kind of understand the breadth of our 24/7 program. So mobile crisis is available, like I said, 24/7, 365 across our entire 7-county region. The blue section is assessments. So this is the number of people that we saw that called us out and said, I'm struggling with something. I'm having a crisis. And we don't define that. We let people define that. So sometimes it's, my kid doesn't want to go to school today. I'm anxious. I'm suicidal. I'm really depressed. Any number of things is kind of what we get called out for. So these assessments are the initial appointment. It's us going out, assessing what's going on, doing some interventions on site, and then providing recommendations. Based on what's happening today, we would recommend therapy or psychiatry, and then we help facilitate those referrals to those services. The yellow is stabilization and intervention. So between the time when we do the assessment and when they start services, so if we say, you could really use therapy, it might be a week. So in between that time, our mobile crisis staff can do stabilization. We can continue to meet with that individual or that family to just make sure that they are staying stable, to make sure whatever intervention we provided we can continue to keep them in a safe space until they can start their ongoing services. So last year, we provided 349 assessments, and as you can see, the majority of them happened in the client's home. This is where we want to serve them. We want to meet them where they are in their home before they interact with law enforcement, before they go to the ER, so that we can prevent some of those higher cost items. Go ahead.
Dr. Trost,
Yeah.
so you say you want to meet them in their home. Is that a physical presence in their home, or is that perhaps a Zoom meeting or a telephone call?
Either or. So most of the time, it's either Zoom or it's in person, and we really give the clients the choice. Sometimes they're like, I want you here right now. I don't want to wait 45 minutes for you to get here, and we do the Zoom option. Sometimes it is because we have only one provider on staff at that time on call, and we can't go to a client's home without two people for safety reasons. So sometimes that option is limited to Zoom because of just the availability of staff. But I would say most of the time we have that option to say, what would work best in this situation? What is clinically appropriate? And what does that person need? With kids, we really like to send two people because oftentimes we can take one with the parents and one with the kiddo, and we separate and conquer, and then, kind of bring it back together with what are the needs and how can we intervene at this moment. So, yeah,
Thank you
great
very much.
question. The stabilization and intervention as well can happen virtually or over the phone or in person. So that is pretty variable as well. And then sometimes we have people choose, as you can see, our Woodland Center's office, they come to us. Sometimes people don't want us in their home, and that's okay. And so they come to our office and we'll meet them there. So that's another piece of it. Last year, we provided 1,155 stabilizations. This number continues to grow every year, which is great. It's what we want to see. So, yeah.
Mr. Chair, thank you. Dr. Trost, can you comment a little bit more on the jail services, how that's going? That's somewhat new.
Yeah.
And then I see there's 3 youth under the stabilization. Is that part of Prairie Lakes Youth Program, or is that still part of the jail services?
That is interesting. I'm not sure. I'm wondering if
Okay,
that is
okay.
Prairie Lakes,
Yeah.
but, or maybe we
Because
met
you're
with,
from in there.
met with a youth through a family assessment. That could
Okay.
be. But yeah, so we do have our jail mental health services that we're providing through Candiway County, which I think are going really well. We've had a really good partnership. We continue to meet with the jail to just assess how are things going, problem solve when there have been any glitches. So we have a therapist on site and a little bit virtually. I believe it's at 8 hours a week right now. And then we have a care coordinator and also a skills worker that's kind of a joint position on site as well to help just with facilitating referrals, doing some skills work while somebody's in jail, and helping with just get them into services before they leave is the goal. So that's going really well. When we have mobile go out, oftentimes is when somebody is being released from jail and they might be on a suicide watch. And we have our mobile team assess them and maybe our staff are not available, like the clinician's not available any longer. It might be 4 or 5 in the afternoon. There's no clinician on site anymore. And so our mobile team will go do the assessment rather than the jail sending that person to the ER to assess if they're safe for discharge or for release. Yeah. And then we can follow them as well, as you can see through the stabilization. Yeah. I'm not sure about the youth one. I'm not sure. I don't have an answer for that one.
So kind of a continuation of that, if you look over on the yellow chart, those probably those charts are separate, right? Because it shows on the line for jail, 3 youth, 27 on the stabilization side. Is that in the jail?
That would be outside of the jail, typically.
Okay.
Typically, those would be outside of the jail, but they might have started in the jail. Or it might be somebody we did an assessment on and then they go to jail, and then we can do a stabilization there too. So it could be a little bit of both.
Okay.
Yep, for sure. The next chart is modality of services over time. I just wanted to show you all how our services have shifted and changed over the years. So in 2019 and prior, we did very little telehealth. We had about 1% in 2019, which was our psychiatry department doing some telehealth services. And then the world fell apart in 2020 with COVID-19. And as you can see, we really did a lot of service virtually, which everybody kind of had to move to that. Over time, you can see that our in-person presence continues to grow. More people are requesting in-person services. And so we will always have a place for telehealth. I never see that going away. But as we get back to some sense of normalcy in our world, I think people are wanting to come back into the world and see people face to face. And this is overall Woodland Centers. When you look at certain programs, you can see this flip a little bit. So some of that is based on our staff availability. We have psychiatry providers that some of them are not here. They are telehealth 100% because we contract for them. And so when you look at psychiatry as a modality, you'll see that flip. There's less in-person and more telehealth happening when we get to program specific. But overall for Woodland Centers, this kind of gives you a picture of where we're at. Then the last chart.
Could I ask
Go
a question?
ahead.
Yes, go ahead.
Yeah, so, thank you. The telehealth, is that done, I mean, I'm sure you do it 24 hours a day,
Yeah.
but do you think it's more in the evenings when when you are just down to one person, or is it, or
For
is it
mobile,
just pretty
yes.
much anything? So,
For mobile, it would be. I would say for telehealth for other services, it's happening during the day. So we have providers that work from home. We also have it available where if somebody doesn't have access to a device, they can come to our site and we will set them up with a computer and set up the Zoom for them and they can just sit down. So sometimes that's worked better for people. We've had more individuals, I think, access services because there's less of a barrier. I can take my lunch hour and go sit in my car and go to my therapy appointment and not have to take time off of work. And that's a big benefit for people to not have to, take time off and be able to get their services. So, but we have a mix. Yeah,
Okay.
it's a great question. The next chart is our comprehensive evaluations, and we made a shift in late 2020. It was December 2020. We started our same-day access process. And what this was is saying, if you come in for services, we'll get you seen today, because in order to start mental health or substance use services, you have to have what we call a diagnostic assessment, or we call it a comprehensive eval. And it's a pretty long appointment where we go through your entire history and try to figure out, do you have a diagnosis and what services would be a best fit for you? Prior to implementing same-day access, you would call and we would say, okay, we'll get you seen in 3, 4, 5, 6, 7 weeks. And here's your appointment in that amount of time. And when we did that, you can see the no-show rate was 26, 27%. Because in 3, 4, 5, 6, 7 weeks, maybe your issue resolved. Maybe you got seen somewhere else. Maybe you decided, I don't really want to do this anymore. And you just didn't come to your appointment. So we knew we needed to do something because these are very valuable times. It's clinician time, and they were not being utilized very well. So 2021, you can see our no-show rate. Even when we said, call today, we'll get you scheduled today, we still had an 11% no-show rate. I don't know how to get rid of that, but so it reduced significantly, a pretty significant change. So we were utilizing more of our time more effectively. And then you can see in 2022, it was a 72% jump in just the number of evals we did. So we started off with 8 slots a day, eight times we'll do a comp eval. Some days right now we're up to 15. We do 15 of these evaluations a day. We have 5 FTE that this is all they do every day, all day. And there are still days where we don't have enough slots. So we're still trying to get that magic number of how do we have enough, but not excessive time where we're wasting time either. So it's still a tricky thing on that perspective, but we feel like it's working more effectively for our clients and for our staff.
Dr. Trost, there seems to be a big shortage in your field as well as
Yes.
all over. These full-time equivalents that are doing these evals, what is their training? What is their background?
Yeah, they are master's level clinicians. We could not find them locally, so they are actually contracted through a Novotel. So we have one that lives in Arizona, one that lives in Hawaii, one that lives in Wisconsin. So they are all over the place because a Novotel could find these folks and we could not find them locally.
So those are obviously done via Zoom or
Via Zoom.
telephone.
Correct, yes, yep. And we prefer not to do them over telephone. Our first modality is Zoom because so much of what we do is the nonverbals. You might tell us one thing, but when we see your body language, it tells us a whole nother thing. So we like to see the person. Telephone is our very last option that we try to take. Yeah, great question. So that's all of our evaluation no-show reports. Was there any other questions on that? Okay, perfect. So 2022 was a pretty big year for us. We became certified as a CCBHC. This really took everything we did and shifted it on its head. We moved from diagnostic assessments to comprehensive evaluations, which really means we're looking at the whole person. We're evaluating not only their mental health and substance use needs, but what are their physical health needs? How can we help them with their social determinants of health and attach them to resources in our communities. It also meant we added a lot of different services. We added an adolescent substance use program, which the day it opened, it was full. It's been very, very busy. We added medication-assisted treatment. So this is if you have like an opioid use disorder or an alcohol use disorder, tobacco use disorder, we can give you prescription medication to help you overcome that and live a life of sobriety. We started our jail mental health services here in Kandiyohi County, and I'm happy to report in 2023, we added jail mental health services in Chippewa County and in Douglas County, so it's a growing program. We started urgent care for mental health here in Kandiyohi. Well, we started in Kandiyohi County and now expanded it out to our other sites, but this is really using our mobile crisis team as an urgent care team. So if you walk in our door and you say, I just need to talk to somebody, we'll get you seen. Everybody knows what urgent care is for physical health. You go in, you talk to somebody, they tell you this is what we think it is, and you go home. When we said to people, come in for crisis, people immediately equated that to, I'm going to be stuck there. I'm going to have to stay there. I'm going to have to be overnight. And so we tried to use this modality of urgent care for mental health to say, you know, this really is a place where you can just come in, talk to somebody, get your needs met, and go home. And it's been working. So the first 6 months of 2023, we did 86 assessments and we did 194 stabilizations. And 28% of those were youth walking in our door with their families that just had an immediate need. We also started some targeted case management. We have one FTE that covers our entire 7-county region, so it's a pretty small program for us. But it's often those folks that maybe won't come to the county, don't feel comfortable getting targeted case management from the county, and we can help fill some of those gaps for those folks. We also have peer support services. There's 3 levels of peers, adult peers, family level peers, and then we have recovery peers. And so these are people that have lived experience that can walk the journey with somebody that maybe has never been in services. We know the mental health system is complicated, just like the healthcare system. And so these folks can kind of walk the journey and say, you know, I've been there too. I understand how hard this is. Let me help you through this journey. And then we started care coordination activities under CCBHC. So it's been a busy couple years getting all these services up and running. The other thing we're pretty proud of is we are a naloxone access site. So anybody can come into our Willmar office and access naloxone for free. We will hand them a kit. We will give them training. And really what this is it's to help with an opiate overdose. Last count, and this was a few months ago, we had handed out over 200 kits, and there are three vials in each kit, so that is 600 doses of naloxone that we've handed out, at least in our communities, which could be 600 lives saved. Our hope is that, you know, somebody is probably still actively using when they have these kits, but it might be that one time that they overdose and get saved, that they're ready for treatment and they're ready for care, and we'll be there and be ready for them when they are. So that's been a pretty big thing for us. We're also doing treatment or training on naloxone kits. So we've gone out to schools, we've gone out to different community sites, and been able to do training on how to administer naloxone. What else? We've done a ton of DEI work internally, diversity, equity, and inclusion work internally with our staff, helping our staff kind of understand all these concepts and how to just be better in our communities and be more accessible. And then last year we were awarded the NAMI Mental Health, NAMI Minnesota's Provider of the Year Award, which was a pretty big honor for us. This year, so far, we were awarded the Schooling to Behavioral Health Grant in 2023. And so what this does is we've had Schooling to Mental Health, which is placing clinicians and skills workers in the schools, which has been very successful. But this year we were awarded this grant so we could put licensed alcohol drug counselors in districts. And what this is for is to help with that preventative care. We know drugs, tobacco, it's in our schools. We know that. And so what these LADCs can do is to go in and say, here's the risks. here's how we can maybe prevent people from using drugs. And if we find an at-risk child that maybe is using, then how can we refer them for services? So this is the hope, is to be more preventative, do more outreach, work with the students, work with the teachers. So the schools we started with is Wilmer, Litchfield, and McRae for this year. And for the 3-year grant, those will be the 3 schools. We're hoping to grow this and really expand it throughout our whole schooling mental health program. But we wanted to start and just try some things and see what works. So we have hired 1 LADC, and then another one is coming. So we have two hired so far, and more to come. It's a pretty exciting program. We started partnerships with the American Heart Association. We are the only mental health center in the entire country that is partnering with the American Heart Association. And this is to help with diabetes care, high blood pressure, high cholesterol. We know that people with severe mental health conditions die 25 years younger than the average population. And that is because they're not getting their physical health needs met. And so if we can be a part of that and monitor that and help them to get those access points, that's what we want to do, and the American Heart Association can help us with that. And then the other piece is we partnered with the Heart, Brain, and Lung Alliance to help with tobacco cessation. Again, we also know a lot of our clients smoke. We know the risks for that. And so when they're ready, we want to have people prepared to have those conversations about tobacco cessation. What are the resources? What are the risks, so that our clients can just have that education and have it available on site at Woodland Centers. So that's a lot of information. Any questions?
Any questions? Go ahead.
Thank you, Mr. Chair. Dr. Chose, thank you for being here today. I know recently that you announced that detox services will be ending at Woodland Centers by the end of the year. Ending services is something that I'm sure is never taken lightly.
Never.
Can you talk a little bit for the general public what went into that decision to end those detox services?
Yeah, absolutely. Thank you for that question. So detox has been part of Woodland Center's staple core services since the 1970s, 1980s. It is a service that is not paid for by any insurance. It is really funded by our counties, and the cost to provide that service continues to grow and grow. What we have is it's not a medical detox, so we really provide detox services for people with alcohol use disorders, sometimes methamphetamine disorders if we can manage that on our unit, but we don't do opiate withdrawal. So there's some things that just need more of a medical component that we don't have. But we do staff it with 24-hour nursing. And the cost to have nursing has increased substantially over the years. And to have nursing, it's really challenging to find. Like all the other healthcare fields, it's a really challenging discipline to find and maintain, especially for a 24-hour program. The other thing that we found over the last several years is our referrals have decreased substantially. And we went out this year, starting in, I want to say March, and met with all of our county social service directors, law enforcement, hospitals, and just said, we're seeing this decrease in referrals. Are you guys noticing that? Are you not seeing people with alcohol use disorders? Like, what's going on? And law enforcement was pretty clear in saying they used to be a big source of our referrals. They were pretty clear in saying, yes, we're still seeing people with alcohol use disorders, but oftentimes they're in their home, and we can't remove them from their home. And so they're at home. And so some of that is just the change that has happened. Or they're at such a high level, they need medical care, because we can only handle so much in our detox unit. So we're not having that middle ground anymore where people are intoxicated out in the community and they need law enforcement intervention. They're often in their homes where law enforcement isn't intervening, or they're at such high need that they need to go to a hospital. And so it's almost this feel of, is detox services like what we provide maybe not as necessary? But we are seeing a big need for detox services for opiates, and that is beyond what we can provide in our small 7-bed unit. You need 24-hour medical care, and we don't have a physician on site. Just to give you an idea of what our capacity has been, we have 7 beds, like I said, and on average we have a census of 2. So to have that much staffing and that much care for 2 people, it's a really expensive service for our counties. And just after a really thorough analysis of the costs, the utilization, how it would impact all of our counties. We just felt like it was a service we couldn't continue.
Because this was about $950,000 over the past 5 years.
That we've lost.
That were unreimbursable.
Correct, that's correct.
Expenditures.
Yes, yeah,
Which falls into that as well.
correct, yeah.
So the future then of that area in the detox?
Yeah, we're looking at that right now. So we have, we're looking at how can we maybe expand our adult and youth crisis units and then move our urgent care into that space. So we'd have more space for urgent care services. So we're talking to some contractors right now, thinking about how we would have to renovate some of the space because we have Department of Health and Department of Human Services to oversee that space. So we'd have to meet all of their requirements. But those are some things that we're looking at. Yes.
Outstanding, thank you.
Yes, thank you.
Thank you. Other questions for Dr. Chose? Well, thank you very much for the update. I think we're pretty fortunate to have,
Oh.
do you have something? I'm sorry, I missed that. Did you have something you wanted?
No, I don't know if you're done, though, are you?
Did you want me to talk about the purchase of service contract? That was my last
Yeah.
piece.
Oh,
I'm
yes.
sorry. I know.
sorry.
I'm talking a lot. We just have a lot going on.
Well, I had Corinne up for that, so you can tag team that.
Okay, perfect. What, do you want me to start? I'll start. So, purchase of service contract, for 6 months at the beginning of the year, we walked through our contract almost line by line with our social service directors from all of our 7 counties to just make sure the statutes were up to date, the language was up to date. All of us had a clear understanding of what it is this contract is for, what types of reporting everybody would want to see. And so I think we came to a really great place together of creating a good contract. And then we went through the county attorneys and everybody approved it. So that was a beautiful thing. So what you will see before you today is that finalized contract with all the different updated language, essentially. What we're asking for in 2024 is a 2% increase overall to the contract. Really, there's some just additional costs to providing these services. The rates for everything is going up. And as we saw, just the clinical supervision for the counties increased substantially. As counties were trying to find staff, they didn't have people with experience. And so it required weekly supervision for a lot of folks coming in, and we provide that supervision. And so that cost just grows. The other piece is looking at the adult crisis and youth crisis rates. You can take detox off of there because that will not be in the contract. But we did a 15% increase to these rates. We have not done an increase for quite some time, since 2020, but inflation continues to go up in those units. And so that's kind of what we're looking at for this year. Do you guys have any questions on that?
So and just as a point of clarification,
Yes.
Kennewick County receives by far the largest percent of the services, so therefore we pay the largest amount in our contract. It's prorated based on that usage, correct?
So the original calculation of these was back in the 1980s, and it was an admin fee and then a dollar amount per resident at that time. And then over time, it's just been a percentage increase. So we don't actually calculate it based on usage now or based on population now. It has just been an increase over time. But because of the population of Candioi County, that dollar amount has always been the highest and the utilization has always been the highest.
Sure.
Yeah. Yep.
All right. So you would like
Well,
Well, I will let
Well, can I
Corinne,
just-
yes.
Yeah.
Yes.
summarize it, may I speak?
Yes.
Oh, okay, thank you. Well, before you leave, I just want to say thank you. We are so lucky in Candioi County. The Candioi County Board is the mental health authority for the county. And to have services like this, when you listen to the services that Woodlands provides in a rural area, we are exceptionally lucky. And kudos to all the positive and progressive changes to meet people where they're at in so many different ways, going to the Skylark Mall, having people there available, the mobile service team, and so forth. But also, it sounds like, oh, we got this covered. We don't. I think you're making a big dent in the needs. I'm just amazed how the needs are still out there. And I know your staff are really getting stretched at times, like everybody else's staff, but you're doing a great job working and supporting your staff too. Would you just share how many staff there you have?
Yeah, that's great. Yeah, we have 225 staff at this point. About 2 years ago, we had about 180. So we've grown a lot in the last couple of years. Yeah, yes.
So we're lucky to have Woodlands here.
Well, thank you. Thank you all for your support as well. It's very important to us, so thank you. And I'll let
Thanks,
Corinne-
Dr. Joseph.
Yes, thank you.
Corinne?
I just wanted to add that, just so people understand, that this purchase of service is to meet, as Commissioner Burke says, we're the mental health authority for the county. And then we have statutory requirements of what type of services that we are required to provide for our residents. And that's what this purchase of service covers, is those statutory requirements, and that's covered across the 7 counties. So that's all I had as an addition to Dr. Chosa's 2% increase.
Thank you. And your hope for action on this today, correct?
Correct.
So I'd entertain a motion to accept this contract of services with Woodland Centers.
Oh, so move.
Commissioner Gardner moves. Do I hear a second?
I'll second that.
Commissioner Dwayne Anderson seconds. Any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thanks, Chris.
Thank you.
All right. Next up on our agenda is the Resolution 2023-35, adopting the Glacier Lake sanitary sewer and water meter charges and usage. Corey?
Good morning, Mr. Chair, members of the board. Corey Smith, Director with Glacier Lake Sanitary Sewer and Water District. I'm here before you today, like Roger said, to bring forward Resolution 2023-35 for adopting the 2024 water and sewer utility rates, meter charges, usage fees, and special assessments. A little background to this. Last year, Eilers conducted a rate study for the district. The results called for incremental increases to the operating and capital budgets to ensure that we had long-term fiscal health. For 2024, they recommended increasing our capital fund, which is Fund 29, by 3.5%. Fund 29 is for our debt services. For our operational fund, which is Fund 28, they recommended that we increase the rates by 6.25%. The operating fund pays for the day-to-day operations of the water and wastewater facility. To get to today, we had multiple discussions with staff, multiple budget committee meetings, and discussions with the Glacier Lakes Commission as well. On September 25th, the Glacier Lakes Commission approved the 2024 budget and recommended forwarding it to the county board here today. In your packet, I included the budget summary page. It's the one with the blue header on there. Over on the top left side, under meter usage and special assessments, the first line is special assessments, capital fund 29. Again, that's debt service. That dollar amount will be $732,780. That special assessment, that's also known as a base fee. That's what paid for the infrastructure around the lakes. The second line is fixed meter fees for a total of $1,723,725.48. This is a monthly base fee that the resident receives regardless if they use a drop of water or generate any wastewater. The third one down, O&M usage fee for wastewater for $1,478,744.24. That is the expected revenue from wastewater usage. And the last line down there is the water, and that's $508,239.88, and that's for water usage. So in altogether, our total budget for 2024 is $4,443,489.60. On the rest of the page there, I listed some of our bigger projects or accomplishments that we've had. Underneath that are just some facts that you can take with you. The next sheet I want to talk about is the Exhibit A. It's then This lays out the sewer and water usage charges, base fees, admin fees, and annual assessments. As you can see, the larger meter you have, the higher amount of your base fee. Just to put in perspective, over 90% of our residents have a 5/8 or 3/4 inch meter. And the largest meter in our system is a 4-inch meter. With that, it's staff's recommendation to approve and adopt the budget as laid out in Resolution 2023-45, as well as the rate shown in Exhibit A.
And I might add, it's also the commission, the sewer, Water and Sewer Commission's recommendation.
Correct. Yep.
Follow the staff's recommendations, so. I'd entertain a motion on Resolution 2023-35.
Mr. Chair, I'll move to adopt.
Commissioner Dale Anderson moves. Do I hear a second?
Mr. Chair, I'll second that.
Commissioner Berg seconds. Any questions or comments? I just want to say that this is a really large number, and it might surprise a lot of people, but I think next week, is it, we do our road and bridge meeting from the sewer, and you're going to get a tour of it, and you'll understand why it's an expensive proposition to cover 57 square miles to try to keep our lakes and rivers, sewage out of lakes and rivers.
Correct. Yeah.
There's no way we could have a septic system on each one of those properties around those lakes. So, any other comments or questions? If not, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thanks a lot, Corey.
Thank you.
All right, Sheriff, you are up next with a resolution 2023-36, and then we're going to take a break after that.
Before me or after me?
Did I say afternoon?
Good morning, Mr. Chair and Board and Administrator Baker. Eric Tollefson, Candidacy County Sheriff. I'm here to ask for the resolution 2023-36. This is their annual Office of Traffic Safety Enforcement Projects grant from in cooperation with the state and federal government. The grant period covers October 1st, 2023 to September 30th of 2024. If you want any details on the grant, I don't think I included the spread or the amount of it. Did that get sent to you guys? Okay. Total of $73,700, and then on the spreadsheet, it kind of shows you what areas of enforcement each will receive what specific dollar amounts and that kind of thing, so. And of course, this is based on, the amount of the grant. It has a lot to do with traffic numbers from the previous year. Unfortunately, we, in Candidacy County, we were in the top 10 fatal counties for 2022. Also, we're on track right now in 2023 to be, we're in 8th place right now, so. Which isn't a good place to be, but.
No, it's not a batting average you
No,
aspire to, but.
No, it's not.
So, any other questions for Sheriff? Then I'd entertain a motion for resolution 2023-36 towards zero death.
Mr. Chair, I move that we pass or adopt resolution 2023-36.
Commissioner Dwayne Anderson moves on 2023-36. Do I hear a second?
I'll second.
Commissioner Gardner seconds. Any further discussion or comments? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Sheriff.
Nope, thanks, guys.
Have a good morning.
You too.
We're going to take a 5-minute break.
And safe morning, yes.
We'll reconvene the Kennewick County Board of Commissioners meeting. Next up on our agenda is a final payment and acceptance for road work done. Mel Odens, County Works Director.
Yep, I'm Mel Odens, Mr. Chair, members of the board, the Public Works Director for Kennewick County. The first one is our crack filling that we do every year, and Northwest Asphalt and Maintenance out of Thief River Falls was a successful bidder. We do between 30 and 40 miles every year, and what this is on all our overlay projects, about 3 years later, we go and fill all the cracks so that the water doesn't get into the subgrid, and then all our new pavement, we do probably we come back like every maybe 7 to 9 years. So we spend right in that $200,000, $250,000 a year. We're just trying to keep up with all the overlays and new construction. So it's my recommendation to accept the project and authorize final payment in the amount of $2,076.41, which represents the final retainage to Northwest Asphalt and Maintenance out of Thief River Falls.
You've heard the recommendation from the Public Works Director on the final payment. How do you wish to proceed? I'd entertain a motion to make that.
I'll make that motion that we make the final payment to Northwest Asphalt and Maintenance of Thief River Falls for $200,421.
Or let's go with 2,000.
2,076.
Oops,
7641.
did I miss that? Okay, sorry, 2,076.41, sorry. The total is 200,000, sorry.
You just wondered if I'm
It
paying
started out there, though. It started out.
Commissioner
They're good friends
Anderson
of mine,
moves on the, Commissioner Anderson moves on the final payment for the crack filling. Do I hear a second?
Corky Berg will.
Commissioner Berg seconds. Any discussion? Hearing none?
just a
Oh, I'm
question.
sorry, go ahead.
Thank you, Mr. Chair. Mel, just for the general public, can you explain to them the importance of doing the crack sealing as it relates to keeping the roads, our investment in our roads in top shape?
Yep. So any road, whether it's, in our case, asphalt roads, after they get a certain life, they're going to crack. And the biggest culprit of any road integrity is keeping the water out of the subgrade. And so when a road cracks, what you do is you literally take a router and you route the crack. So you have a clean edge, 1/4 inch wide. And then what we do in our county is we double fill them. We fill the lower one, let it set up, and then we fill the top one so you don't have you fill it correctly, if you will, in the way we view it. And so basically what it does is it fills the crack with an oil compound that adheres to the existing asphalt that doesn't allow water down into the subgrade.
And this is just simply keeping our future expenditures down by keeping the roads in good shape.
Yep.
So
And
this
then-
is for relatively small and, 250.
200,000 for
a year
35
isn't
miles this year.
chicken feed, but it's a lot better than spending millions of dollars later or earlier than you have to.
Yeah, we would spend that per mile on an overlay. And we did 32 miles for the same amount of money. The other thing that it does do is the tire slap, when you get a crack, you start getting the tires slap and then they'll start cupping. And so that it prevents that cupping, and then we seal coat it in a few years. So,
Very good.
yep.
Thank you.
All right, any other questions or comments? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. You may proceed with the next request.
Mr. Chair, another maintenance activity we do is we do chloride applications for any resident that's within 150 feet from a gravel road. And we do the entire county. And this year, every year, we do about 35 miles of roadway that covers all these spots. And then we also do the last 200 feet, I think it's 100 or 200 feet of a gravel road coming up to any paved road. So the gravel doesn't work its way out onto the paved road. And so we do 300 spot areas and about 35 miles of road it adds up to. We do that annually. This year, Crow River Construction, a local company, was the successful bidder in $201,405. And we feel good about the project, and my recommendation is to accept the project and authorize final payment of the 1% retainage in the amount of $2,193.94.
You heard the recommendation of staff to make final payment for the dust control on the county roads. How do you wish to proceed?
Mr. Chair, I'll move to approve final payment in the amount of $2,193.94 to Crow River Construction.
Commissioner Dale Anderson moves on final payment for the dust control. Do I hear a second?
I'll second.
Commissioner Gardner seconds. Any further discussion or questions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thanks, Mel. All right. We will have a presentation on the proposed 2024 county park policies and fees by Administrator Baker.
Good morning, members of the board. Kelsey Baker, County Administrator. I don't really have a full presentation, but I can give you a recap. So a few weeks ago, the park committee met with all 5 park managers. Commissioner Dale Anderson and Commissioner Dwayne Anderson sit on that committee. Commissioner Dwayne Anderson was able to attend. So we go over, what we do at this meeting is we go over what was good, bad, things that we can work on for the 2024 season, things that we can improve on, things that we should change, all of that. We go through the rates and then the policy. So what we're proposing for 2024 are we're not proposing any rate changes. So we will have the same rates as 23 into 2024, and then no policy changes. So the only thing that came out of that meeting really was that we're gonna work more on the marketing for our county parks. I have a meeting with Beth Fisher with the CVB this week. And so we're gonna try work on the marketing at the end of this year and then into next year, and then kind of throughout the year, more collaboratively between the county and CVB on promoting the parks that we have here in the county. So hopefully we'll have some exciting news to report in a few months and what those marketing details will be. Reservations will go online January 23rd, 2024, starting at 10 a.m. Same processes as this year for the online reservations. Any questions on that?
Any questions for Ms. Baker? So I have a couple, and I'm not sure if you're prepared to answer them. So during COVID, we saw a sharp increase in park usage, largely because that was something we could do safely, is to entertain outdoors. And then I think the following year was still pretty good, but has there been some drop off since then as there's more options available now?
You know, we did see a drop in revenue this year, and one thing I think is okay to say publicly is the county does not make a lot of revenue on our county parks, where we really break even most years, and I think that's okay to say. It's an amenity that the county provides, and we are willing to do that. But this year, I think some of the comments were from the park managers, were maybe some of the rates, people getting used to those rate increases. And I think you bring up a really good point, Mr. Chair, is that during COVID, a lot of people went and bought campers, because that was something you could do. And then now we're 3 years later, and maybe they're selling their campers and people aren't going camping. School activities have picked back up throughout the summer months. We had some high heat that I know that some park managers said that affected people coming to the beach and different things like that. And so I think there was many different things that affected the 2023 season financially. And that's one thing that we thought we would keep the rates the same. We aren't changing anything in the policy, and we're gonna try more of a different angle for marketing going into 2024.
And follow-up question, and again, you may not be prepared to answer it if the information isn't in front of you, but 2023 usage versus, say, 2019 or 2018 pre-COVID, are we pretty close to what the usage was in those years?
No.
No.
Probably a few parks. We have some key parks that do extremely well.
and probably will stay consistent. We have a few parks that have struggled, but it's really kind of been a valley for one park. One park did struggle really bad this year. I could say one or two parks, our numbers were fairly low. Let's say, you know, the one that maybe has 80 camping spots and we're around 40 or 50.
Okay. I would just comment, for someone who lives in the northern part of the county where there's a lot of tourism, some people say, well, if the parks aren't making us any money, why do we have them? I could say that about roads too, and the answer to roads would be we get produce from farm to market. Well, on a Saturday morning when it's raining, I can personally attest to the people that come out of the parks and go to the businesses to looking for something to do besides watching the rainfall out in the park campgrounds. And we personally have done a lot of business with people who have visited our parks, so it does support business. So, thank you for that. Is there Commissioner Gardner?
Thank you, Mr. Chair. Just a comment that when we increased these rates, I believe that was 2 years ago, we were below market compared to most of the private providers of camping services here and in the region. And, you know, we were at a competitive advantage at that time as well, which was really unfair to those other providers. By bringing these rates more in line with what's out there otherwise available, we addressed a sense of fairness, but we frankly also addressed the need to continue to invest in the infrastructure in those parks. And it was a necessary thing to do then. I am glad to see that the rates are going to remain stable this year. And I think you're going to see some stabilization coming out of, and I can attest to this, pre-COVID, we purchased a camper and the shine has worn off, so to speak. Where, you know, it's not quite as fun as it used to be because it's a little bit of work. And a lot of folks did buy campers over COVID. And now, like Administrator Baker said, they have other things that they can do during the summer now. So it matters a little bit, but I think overall people are happy with the services that we provide, and I think you're going to see some of that capacity stabilize as we move forward.
Thank you, Commissioner Berg.
Well, actually, I was just going to say basically the same thing. Thank you. I'm really glad to hear that the rates are going to stay the same, and the numbers worked out that way, so that's good.
So one thing, and I'm not even sure how the State Park Association, the DNR, is going to handle this, but for those of you who don't know, Lakeside Campground in Sibley State Park will be closed next year. There's a major renovation going on down there. That campground was created and constructed when we used the back of our pickup or the trunk of our car as our camper, and now they come in with big ones. So they're doing a major renovation there. There'll be less campsites. So perhaps an alternative is one of our county parks for those of you who use Sibley and the Lakeside.
Absolutely, and I think that's what kind of spurred the conversation on how are we going to market our county parks, maybe more aggressively this year so that they know that these spots are available. And so I'm excited what we're going to come up with and what we'll have going forward in '24.
And this might be a good time, you know, when we do work, any kind of work, whether it's road construction or building a building and using federal dollars, we have situations that come up regarding archaeological work. And so one of our county parks had some work that was going to be done on it, and we did what we always have to do for regional studies. So I'm going to read a statement about work that was done at, or proposed being done at one of our county parks. Throughout the process of receiving grants for a new bathhouse at Big Candy East County Park, which is located within the boundaries of a Minnesota archaeological site, I won't read the number, We have learned that this area was a burial ground and a revered area for indigenous people. Moving forward, we will be working with the Minnesota Indian Affairs Council to comply and better understand Minnesota State Statute 307.08 and look at our options and opportunities while remaining respectful where their ancestors are buried. We will keep the campers and the public aware of any changes. However, this will be a long process, and we hope you understand as we work together for a positive solution for all. And I just want to say this is common all over. Road construction, Mel can attest to that, not only in Candiota County, but all across the region. And so it's not a big deal necessarily, but it is something that we have to be respectful of. So anything further
I am asking for approval.
of the park policy?
For the
and-
park policy.
You want them in one, policy and
Yes.
rates?
Yep.
I'd entertain a motion on the 2024 park rates and policy for Kennewick County.
So moved.
Mr. Gardner moves. Do I hear a second?
I'll second that.
Commissioner Dwayne Anderson seconds. Any further comments or questions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Ms. Baker?
All right, well, I'm on here a few different times, so you're gonna be hearing
Keep
from me
going.
for a while. So today, I'm asking for approval for an addendum to the memorandum of understanding with extension. I put in the request form, kind of the background that I received from Trish here, and she's in is she in the room? Hi, do you want to do this? I sure did. Okay. I didn't know she was gonna be able to be here today.
Stuck in
so-
behind us.
It's. What we are,
Excuse me.
yes,
For the record, and there's people who might be listening and or watching, if you would state your name and who you're representing.
Perfect. Trish Sheehan. I am a regional director with the University of Minnesota Extension. And today we are bringing to you an addendum to our memorandum of agreement. This addendum is for a SNAP Ed position. It's an education coordinator that we are hiring through a federal grant funds that we receive at the state level. And we have not had this position in a while in Candiota County. The position was vacated by a previous person, and there was been some challenges with finances, and so those finances have come back into extension, and we have been able to look at where it best fits to have a SNAP Ed coordinator, and Candiota County is one of those places that we are going to be placing an individual. The past couple years, it's been at the regional office because we have had a test kitchen that they can use. We still have that test kitchen that they can use, but this is a more county-based position and not a regional position. And so we really find it would be important to have them sit in the extension office. And I'm guessing Corky maybe remembers some of the SNAP Ed coordinators we've had in the past, but they work with Health and Human Services, Public Health, to be able to deliver nutrition education. And so basically, this is just an addendum stating that there'll be a position in the office. There is a space in our office for them. And we also note that the computer will be provided by extension for that individual. So we're looking for a signature today. We have our county extension committee chair's signature already, and then we provide it to you guys for that additional signature and okay.
Thank you. Any questions for Ms. Sheehan? I think I heard you say the office would be at the campus, but it's going to be in this building.
It'll be here at the extension office in this building.
building, okay.
Previously, it was housed at the regional office.
Yep.
But they'll still have access to the test kitchen. And but then they'll be able to meet here where more of their audience would be.
Very good. Any other questions or comments? Then I'd entertain a motion to approve the addendum and accept the position for the SNAP Ed coordinator.
Also move.
Commissioner Dale Anderson moves. Do I hear a second?
I'll second that.
Commissioner Dwayne Anderson seconds. Any other comments or questions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thanks, Ms. Sheehan.
Thank you.
All right, we have another amendment to consider on a lease agreement with Central Care Rescue Squad at the Central Care Rescue Squad building. Ms. Baker?
Yes, so today we're asking for an amendment regarding the Rescue Squad building lease. It ended September 30th, 2023, so this will be a new lease starting October 1. I'm a little behind on this, my apologies. We've been working with the Centricare Realty specialists, along with attorney Shane Baker and then emergency manager Stephanie Felt. So what's in this amendment to the lease is we're changing it to month. They still have to require to give us a notice, but the lease will be October 1st through 2023 through March 31st, 2025, but it will be a month-to-month. The lease may be terminated at any time, and they still have to, we're still requiring the 6-month written notice of termination.
Mr. Chair,
Go ahead.
this
Commissioner
question,
Berg.
so there's no different changes financially or in the rates or anything, just the changes in them?
Correct, just the language in the month-to-month.
Okay.
Any other questions? Then I would entertain a motion to accept the amendment to the lease agreement with Centricare.
Mr. Chair, I so move.
Commissioner Berg moves on the motion. Do I hear a second? Or on the amendment? Do I hear a second?
I'll second that.
Commissioner Dwayne Anderson seconds. Any further questions or comments? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Now, moving on to the opioid settlement discussion.
Okay, thank you. And you have, Mr. Chair, if you would be so kind, I have some papers next to you that look like this, a spreadsheet, if you could hand those out. We couldn't really modify the spreadsheets that look decent in a public board packet, so.
You need one change?
This,
Oh, one more.
yep, take that one.
Okay, I also have with me, it's not just me on this committee, I feel, we have our Health and Human Services Director, Caroline Kahn, County Attorney Shane Baker, Sheriff Tellefson, and Community Corrections Director Tammy Jo Lieberg. We have kind of been meeting, they might find it somewhat annoying, but we have been meeting to figure out how we want to provide a recommendation to the county board utilizing our opioid dollars. And I will give a huge kudos to this committee. We've had, I don't want to use the term round and round, but we have kind of gone into different avenues. We've looked at different options. We've gone down, like I said, different avenues, and then we thought this was going to be a positive recommendation to the board. And then we kind of change our tune and go another route. So we do feel extremely confident in bringing this recommendation forth to the board, that we would like to propose to create a community task force that would be an application process up to 15 members, that would utilize these dollars to collaborate with community solutions, would provide more of a community input. We would have staff involvement, and it says in this request form that we would utilize our new public health planner that we jointly have with Runnville County through our community health board. And so we're not asking to start the process right now with the application, because part of the opioid dollars within the federal statements and statutes is that you need to have public comment in some sort of way. And so by doing this, we'd like to recommend this to the board, have your ideas, thoughts, recommendations, or if you want us to look at different avenues, we can sure do that. But I would like to maybe hold on this for a while, and if we receive any public comments, if the commissioners do, or if this committee does, we would come back to the board if there were any changes. If we don't hear any changes, we would like to move forward with this community task force. Kandiyohi County did not receive a lot of funding per capita for the size of our county, based with other counties that are smaller than this, and they did receive more funding. Part of this is due to our physicians doing their job with not providing opioids, but the spreadsheet is over the course of the years, how much money we will be receiving every year. So you can see it's a lot, not a lot of dollars, We are large enough that it was a little tough to collaborate with another county. We did look at that with Runville County just because of our community health board. But we feel that we have a lot of needs just within Candioi County that we can still utilize these dollars in a positive way. You know, that this community task force might be community awareness, social media campaign, billboards, support groups. That's something that they will work towards and figure out. Like I said, within this committee, we will probably have staff sit in, maybe not make up of that 15 members, but for instance, Community Corrections Director will probably sit in with this committee to help provide some guidance and so on, and Health and Human Services Director Caroline Kahn as well.
So this committee will be comprised of, will there be, did I read up to 15 or 12 or 15 members of the community and?
Community, yep.
Okay.
And so-
Including medical and educational?
Yeah, so I maybe would invite Tammy Jo if you want to come up here. It was Tammy Jo and Caroline at our last meeting that kind of talked about what the application process would be for one of these task force members, if you want to.
And while Tammy Jo makes her way up here, I'll just give a little background on, I'm sure everybody has heard over the past 3 years, maybe more, of the ongoing litigation between government, federal government, and pharmaceuticals over opioid mismanagement, I'll call it that. And so many settlements were made, and there was formulas that were developed to spread the settlement dollars around the nation, actually, and the state. And through those formulas, these are the dollars that are arriving in Candioi County. There are 3 counties in the state of Minnesota that, as Kelsey alluded to, had been doing a pretty good job of managing opioid prescriptions, and that was a big part of the formula for how much money you got. And so we essentially got penalized for doing a good job. But we're using what we have, and there's some other resources to put together these projects that we're talking about here today. So Tammy Jo, if you would fill in any gaps that Kelsey may have left or I may have left, appreciate it.
Tammy Jo Lieberg, Community Corrections Director. I'm not actually, I'll kind of randomly talk. I'm not sure which direction to go with it. But for the opioid dollars that we're looking at right now, it's more of a proactive approach. That way, if we pull that, as Kelsey Baker talked about, pulling in that committee to kind of look at that and try and make a difference in our communities where we have people that are significantly still struggling with opioid addiction and other addictions. One of the things that we found when we look at these addictions is the fact that even though a lot of these dollars are earmarked specifically for opioids, the reality of it is a lot of our people, if they can't find opioids, they go to meth or they go to some other type of drug. So it's an over-encompassing problem of addressing chemical health in our community to address public safety.
Yeah, I remember Sheriff Hartog was sheriff at the time. He said, we have more of a problem with meth than we do with opioids in Candioi County. But fortunately, we're able to use these resources for a wide range of.
And it significantly impacts not just, it's everybody in our community, right? I mean, we talk about trying to help the individuals with these addictions, but I mean, they have families and neighbors and brothers and sisters and children. And so it affects whether somebody's going to prison, but it also affects child protection. It affects law enforcement, it affects probation. And that's why we are working together to try and come up with the best course of action with the limited dollars we have from this pot to address this in our community.
Thank you. And Kelsey made it clear she doesn't want any action today on this because she wants us to think about this. And is there going to be, you mentioned a public comment period, is there going to actually be a public hearing on this or just a public comment period so commissioners and anybody in the public can how do they do that? How do they make a public comment?
They would reach out to a commissioner, or they can reach out to myself if they would like to sit in on the committee. What we're going to do is create this application process, and that's going to be somebody in the mental health field, probably somebody from Woodland Centers would be probably able to be on this committee, somebody who has recovered, past addict, somebody maybe who has a family member who's an addict. So we're just now defining some of those areas of what the application process will look like. But where we see this public comment period is if they could call a commissioner and say, yes, we feel like this is a good use of the dollars, or if they would reach out to myself and say what their opinion would be, if they would be interested in some sort of fashion, that would be good. I thought I would do probably a 2-week public comment period and then put the application out in November based off what we hear for feedback.
And I assume the committee members, the sheriff and Caroline Kahn and Tammy Jo, you would welcome any feedback as well, or if people know you better than they know one of us or the administrator, they can reach out to you?
That's correct.
All right, thank you. Okay, I'm gonna, Commissioner Berg, do you
Just
have
to
a
be clear,
question or comment?
So did you or didn't you want us to support or make a motion to actually create this community task force? It says, our recommendation of the board, they would create this task force. You don't need,
Right.
you do want a motion.
If you want to do a motion, that's
Otherwise-
fine, but I don't think we necessarily
Until-
need a
okay,
motion.
okay, fine.
Today,
Yeah, maybe we are better off
Just
waiting for the
sneak-
motion
okay,
to
sure.
see what kind of public
Okay.
comments we get.
It also might be, timing wise, might be nice to have it when we actually have to appoint members to the committee.
Gotcha.
Yeah. Any other comments or questions? All right, well, thank you very much for the update, and we'll look forward to more information down the road. All right. You're still up, Kelsey. We're going to talk about the American Rescue Plan discussion. We have a discussion regarding the American Rescue Plan resources.
yep, and Mr. Chair, again, there are some papers that are sitting next to you, if you could hand those out. It's just a hard copy of what was included in the board packet, if you want to make any notes on there regarding the budget. So it's been requested that the American Relief Plan dollars are discussed at a public board meeting. I have, there you are. I will let Sarah introduce herself. I'll let her get acclimated before I kind of do a run over. So the American Rescue Plan dollars we've received, we have spent we've allocated 75% to broadband. And so why Sarah will be here is to kind of give a broadband update. And then we'll go over some of the county projects that have been allocated and where we're sitting with those funds. And then the future projects that we have that we're considering using these dollars for. So if I may, I'm going to invite Sarah up here. She'll do an introduction, and she's going to provide a recap for where we are at with our broadband.
Thank you. Welcome, Ms. Swedberg. For the
Thank you.
record, state your name and who you're representing.
Great. Good morning, Commissioners. Sarah Swedberg, Business Development Manager for the Candiota County and City of Wilmer Economic Development Commission. For those that might be listening in and unfamiliar, the EDC is where our county broadband committee sits, and I'm the staff lead for that work. As Administrator Baker mentioned, 75% of the county's ARPA funds have been allocated to broadband infrastructure projects. And so what we did was we went through to give you an update on where we're at with those projects and listed them in kind of 4 main buckets. So projects that have already been completed, where money has been spent, projects that are currently in progress, where we've allocated funds to those projects, but those funds just haven't been spent yet. Future projects, ones that we're actively working on right now, and then there's some other smaller commitments that we can talk through as well. So right now, total committed dollars are $2,792,208.02. The projects that have been completed are mostly smaller development projects that we completed in New London and Burbank townships, as well as one in Princeburg and then one in around Long Lake and in the city of Howick, so in Irving and Roseville townships. Those projects, again, have been smaller, but those ones are all completed and were completed last year. In-progress projects that we're currently working on, that we've secured grant dollars for and are currently underway, of course, is our West Broadband Project, so that's St. John's, Dovry, Mamre, and Arctander townships. about $1.3 million in partnership with Federated Telephone Cooperative on that project. And then our Southeast project, which was our most recently funded border-to-border project. And that one, the county's ARPA funds have been allocated as just shy of $400,000. That's going to cover all of the townships, Harrison, Lake Elizabeth, and East Lake Lillian townships. We also came back and asked for just a few extra dollars for the Federated project without going too deep in the weeds. If you recall, RDOF, the Rural Digital Opportunity Fund, LTD, their approval of that project was revoked by the FCC, which opened up the ability for us to serve the majority of the southern part of the county, which is why we hadn't traditionally seen us looking at projects in that area, because we were just being held back from doing that in theory because they were going to be served. And so now that that area has opened up, we've started to look at projects like that Southeast project, but also went back to some homes that were getting passed by the mainline fiber for the four township project, and we're able to serve a few more homes and make that more complete over there. In total, we've passed about 1,300 properties. So again, homes, farms, businesses, community anchor institutions, as the state likes to call them, so your community centers, those kind of things, township halls, with all of those completed and in progress projects. Right now, what we've also allocated, and we're currently actively working on, the border-to-border application opened last week. It's due December 7th, which is nice. We've got a little time, and we've been actively working on our next batch of townships. So we've been pursuing projects in Colfax and Lake Andrew Township, as well as projects in Genesee, Candy, Ojai, Fallon, and Lake Lillian Townships. That will really complete the southeast quadrant if we're successful, especially in that second project, which would then open us up to keep incrementally taking steps further west. Other commitments, we've funded some technology with New Vision Foundation in downtown Wilmer around digital equity and training for kids, so coding and programming training. Paid some lawyer fees that was connected to the West project, and we've also spent some dollars on contractors to help us with all of this work.
Thank you for that update. Commissioner Gardner?
Thank you, Mr. Chair. Good morning, Sarah. There's a footnote under here that says we are currently evaluating. Can you explain what the Enhanced Alternative Connect America cost model is?
Yeah, we were just informed of this new program that was created by the FCC. It's an enhancement of the Alternative Connect American Cost Model that already existed. And what the change is that the FCC, in its original form, the ACAM program, required speeds of 25/3, which we know doesn't meet state standards. So anywhere that ACAM was being allocated to these providers, we could keep building projects and didn't have to, honestly, pay much attention to them because they weren't meeting our standards for speeds. The enhanced program came out truly just a few weeks ago, so we're really still trying to grasp what the implications of this means. And so the EACAM program elevated those speed levels to 100/20, which now means they're considered served by the state if those properties are going to receive this money. In Candy County, the only provider that was awarded or had ACAM dollars prior was TDS. And so we're currently analyzing the data to better understand where that territory is and how we have to scale projects or shift the projects we're pursuing so that we're not overlapping.
So, if I may, there exists, and previously we had issues with legacy providers who could block a project by just saying, well, we intend to serve that. Is this something like that again, potentially?
I want to be careful, I think, in making that claim because the ACAM program was really focused on a lot of smaller providers throughout the state. And so there's lots of really great providers that we can now serve properties with. I think because of the bad taste in our mouth from LTD, we definitely have some concern. And ultimately, that concern stems from us wanting to serve every property in the county with adequate speeds and make sure that there's not economic implications to us waiting and not having a successful project at the end. So again, we're still analyzing the data. We're still understanding where these exact properties are, because it's not, we like to work at the township level and include that whole area. And that's just not, I mean, if you look at the map, they always look like Swiss cheese, right? And so we're really trying to understand what properties are affected by this change. We really don't have a clear answer on that right now. We're working closely with Federated, and we're working really closely with the state of Minnesota so that they understand that as we're trying to put this project together by December 7th, that our intention and our goal is not to put a project in place that would overlap. And so we're actively working on that.
That's fair enough. Thank you.
We'll go with Commissioner Dale Anderson and then Commissioner Berg.
Mr. Chair, Sarah, just wondering if these projects that are future projects get done, about how much of the county, in your, just a guess, would be left that isn't got fiber to it yet?
Yeah, great question. I'm probably going to forget a couple townships, right? But it's really that southwest quadrant, which is where the biggest, we just haven't gotten there yet, right? So that's where the biggest gap is going to remain. So it's going to be Whitefield and Roseland, Edwards, Holland townships. And we're starting to have some good active conversation with those township supervisors. We kind of feel like we've got the formula down. We know how to keep this moving. And so by kind of working ahead of ourselves, we're able to be more proactive as we know future border-to-border projects are going to come out. So southwest quadrant is where we're really looking. We also know that in the northern part, there's still a few gaps. Green Lake Township, New London Township, Wilmer Township, because of Spicer, New London, and the city of Wilmer, there's just less township there, and it's a little trickier because there's more areas served in those townships. And so it just takes a little bit more time to get to the middle as we're incrementally taking these steps towards them.
Thank you.
Yeah.
To that end, I would note that Burbank Township was mentioned, but I don't see it on the list. There's been
Burbank is another one
quite a
that,
bit left for Burbank.
Yeah, there is.
The west half of the township.
yeah. And what's the project that's not reflected on here that I should note as well, to that point, is the USDA's Reconnect program. We received, well, not we, Vibrant Telephone, or Vibrant Broadband received a project from Reconnect 4 that's going to serve portions of Burbank, Irving, and Roseville townships, which we're really excited for. It's part of a $19 million project that also covers portions of Meeker and Stearns County. So it's a great project, and they're very, very particular in the density. So they're serving the least dense of the least dense with that program. And so we're hopeful to come back and fill in those townships as well.
Mr. Burton?
I think Commissioner Anderson had my question, but also I'd like to ask, but maybe this can be part of the presentation to Ms. Baker as well, is the future projects then are also allocated or committed at this point, the dollars for those. So the unspent committed broadband dollars that we're looking at for ARPA dollars, is that is not part of that sheet yet. Those are the other additions.
Yeah, so the future project, that's a good clarification. The future project area, other than the line extension program, the monies for Colfax, Lake Andrew, and then those other 4 townships, that has not come to the county board as a request yet. But because we're working on final project numbers, as engineering is really dialing in those numbers with Federated and Vibrant. So as soon as we have that, I would expect us as a broadband committee to take action on a recommendation to the county board at our November meeting. And then that would come forward to you in preparation for our December 7th application.
May I follow up,
Yeah,
please,
please
Mr.
do.
Chair? Thank you, Mr. Chair. So the uncommitted broadband dollars that we do have, the 2.6 million approximately, that will come out of that then?
Correct.
Yeah, that's what I thought.
Other questions or comments? Go ahead.
I would have, yeah, so basically the ones that you are working on, not these 6 townships here that you just mentioned that we'll be applying for. Part of the problem is we don't have providers that are willing to come forward yet. Is that true, or have they come forward yet?
I think what we're seeing is Vibrant is very aggressive in wanting to continue to expand their territory. It's just going to take us time to get there so that they can feasibly build out these projects as they're getting awarded dollars. And so our anticipation is we're going to continue to make progress with the providers we're currently working with. They just don't feel comfortable knowing that the timeframes they have to spend we have to complete those border-to-border projects within 2 years. And so to take incremental steps through the southern part of the county is a better approach, and I think a more successful approach than trying to just do it all at once and have things missed.
Okay.
All right, thank you, Ms. Swedberg. And I just want to add, I've been part of that committee, and I don't do much of the heavy lifting that certain members of the committee do, but it's a tremendously hardworking committee, and it seems like some of you have been, and some of us have been involved for, feels like 10 years or longer. And only in the last 3 years or 2 years even have we really started to see the fruits of all that hard labor. And now, if you drive around the county, if you live in those areas, you'll see the fiber being buried in the orange cable that you see on the reels alongside of the road. So it's exciting to see that happen. So thanks for your work.
Mr. Chair, the only comment that I do have that I just want to remind the board of is that for the Federated, the West project, that $1.314 million project that the board did just approve that contract. The board did commit $100,000 for that project in December of 2021, $25,000 for each project. So I just wanted to clarify that language was in the contract. The overall project is $1.4 million, but the allocated was the 1.3. The county dollars, I would say very rare. I think the only time the county put in actual county dollars was for this specific project, which was that $100,000 for each of the townships.
Thanks for that clarification. All right, you had more to talk about regarding the ARP dollars.
Right. Within your board packet, there's information. So I've been working with the executive director with Prairie Lakes Youth Program, Holly Booth, on different things that we could do for the students regarding technology and utilizing these dollars. And so she didn't have her request ready for today's board meeting, but hopefully we'll have it at the next board meeting. And that request would be up to $75,000 to utilize that for technology for the students. So we're looking at devices like iPads or laptops that she would be requesting funds for. And so I'm not asking for approval today, but I'm looking for some direction. Is this the route that you are looking for, that we are working with our joint powers agreements on areas that we can utilize these funds? We have a housing trust fund that we've started with in the county under the Candioi County HRA. We did receive some state aid funding. I have that in that request form as well. We're also looking at technology. Can we use it for updating all of our technology within our public meeting areas? Is there something else you want me to look into to utilize these funds? Within the request form as well, the funds have to be allocated by December 31st, 2024, and they have to be spent by December 31st, 2026. So today I'm just looking for ideas, some direction. If you want me to look into anything more and provide more of a recommendation, maybe at the beginning of next year so that we can solidify and allocate those dollars.
So I just want to be clear, right now, and I know there's dollars that have been allocated but not spent because the project is in some level of degree of completion or anticipation. But that uncommitted balance is about $350,599. Is that what I'm understanding?
380.
380.
But we're hoping.
That is if,
380, sorry.
that's if the board approved the Prairie Lakes Youth request.
Yep.
That is if the board approved $300,000 to go to the Housing Trust Fund, and that's if the board would approve the $500,000 to go towards county technology upgrades.
Okay.
Those are all recommendation ideas for the remaining dollars, though nothing has been approved there. The only thing that has been approved is under the county projects graph, IT, cybersecurity, public works, federal grant writer, health and human services staffing, generator for sewer and water, and then the EDC childcare grant match that we did with the city of Wilmer. Those are the only dollars other than broadband that have been fully allocated and committed.
Thank
And
you.
so that's where I'm looking for some recommendations so that we can, if I need to be working with another joint powers or working with some staff on more specific ideas, that we should be coming to the board with more of a recommendation.
And I want to make sure that we exhaust any resources that might be out there as a result of, I'll use the example, I think I mentioned it to you, under IT upgrades, the Investment in Infrastructure Jobs Act, or one of the recent legislations at the federal level has money available for cybersecurity. And so there might be some opportunities where we can preserve some of this funding for more local use if we can get federal grants that cover the same need. So, I don't know, maybe a work session might be in order to look at these last opportunities and accept some sort of recommendations for staff, understanding that it's not a huge amount of money left over, but, if staff has some ideas, so. I'm not prepared today to make a suggestion on anything.
But I think you want some guide, Mr. Chair, may I?
Yes.
But you like still some guidance to move forward with this, we have several things to look at here just initially here, and we do have sometimes since we do have to wait for other people to come, possibly, I believe, for the next agenda item. I just want to make a comment about Prairie Lakes Youth Program, and you've heard from me before, commissioners. We have a very good jail, and we have a fairly new additions to our jail, and it's really kept up, and we have a Class 1 jail and well-managed for adults. But for juveniles, we have an old state hospital building that's been retrofitted to make it a secure facility for juveniles. And it's a joint powers setup that was set up many years ago, and it's still that way, but it's on our property here, and the county owns that building. And I just feel that these adolescents with this kind of building, we're running into complications sometimes with licensing now because of the space and so forth, and not having a gym and other things that need to be done and upkeep on it. So I really am pushing for at least that $75,000 of these ARPA dollars to Prairie Lakes program, if not even more. But also, Ms. Baker, would you just kind of comment for the audience what the ARPA dollars are? It looks like we're just wanting to spend money and where they came from. Would you elaborate on that a little bit more?
Sure.
Why we're doing this and looking at spending this dollars, if we don't, what happens?
Right, so these dollars came from the federal government, so we have federal guidelines, and they're for counties to use these dollars in COVID relief ways. So whether that's ways for organizations to work post-COVID, so they are looking at technology, and within technology is broadband. They're looking at infrastructure, which could be HVAC or any mechanical issues within county facilities and county structures, and then community service and ways to communicate with the public. So the public awareness. And so really it's those three areas that can go back, like we're using one of them for staffing. So it can go back to the staff who utilize those needs. It can go for public works for the grant writers. It's really a broad scheme of things that we can use these dollars for. And the gist of it was post-COVID relief. And so if we all remember the CARES dollars that we received during COVID, this was an extension from the federal government with post-COVID dollars on how to utilize and update structures so that if we were to have another pandemic like this, we are better equipped to continue providing services. We are equipped to have staff work remotely, and we are equipped to provide information to the public in a more timely fashion.
Yeah, and ARP stands for American Rescue Plan dollars, and they did have that sunset of December 31st, 2024 for spending. We were also able to use those dollars as our local match, as is the case with broadband. So we were able to leverage those dollars to get more federal dollars, and so, you know, all of them affected. Broadband might be the most obvious ones when the pandemic hit and kids were trying to learn from home and trying to have 3 videos operating at the same time to do their schoolwork, and it was just plain wasn't working. But there are a lot of other needs, and the Prairie Lakes one is a good one. Now, Holly isn't here today to kind of explain how we'd spend that money, but
Yep.
if we're comfortable moving forward with that allocation, I suppose we could.
Well, and I think
Is there
what
more?
Commissioner Berg said is, today was more of to provide direction. Is there, at the last meeting that we discussed this in April, we came with the ideas for the remaining dollars, excuse me. Prairie Lakes wasn't on that list, and today it's now on that list. So I had worked with Commissioner Berg, and we reached out to Prairie Lakes. We came up with this an idea. I've been working with Commissioner Gardner on the Housing Trust Fund to utilize possibly some of these ARP dollars. Some counties are using the state aid funding to match maybe whatever the largest city in their in their county to put into the Housing Trust Fund, so that maybe we wouldn't have to utilize these ARP dollars. And so if you don't have that direction or guidance, as the chair said, I can look at different grants that we could possibly receive regarding cybersecurity and IT. But in the meantime, if you have any recommendations or ideas to let staff know to look into, I can do that, and we can provide an update again.
I'll give an example of some dollars that were fairly minimal dollars. The grant writer one, we got the $4.8 million, I think it was, for the bridge over the railroad tracks on the southwest side of Wilmer. We used an engineering firm to help to write that grant, that federal grant, and we were successful. And so that's one of the examples I would use for leveraging dollars to bring in more dollars. And it's difficult for our staff, the size of it is, or certainly us commissioners, to even know where to look for all of these opportunities. And so we could utilize some of those dollars for that. Commissioner Gardner.
Thank you, Mr. Chair. I'd like to go to the line item for housing for just a moment, if I may. We did previously identify that as one of the critical areas that we wanted to address with some of this funding. Frankly, my suggestion was for an amount double what is shown in that table. We have some issues across the entire state, across the entire country, with housing availability and housing insecurity. I think it's a critical area for us to be addressing sooner rather than later. Now, everybody here heard during the last legislative session about the historic investment that the state of Minnesota is making in housing. I'm not holding my breath for anything timely that comes out of that, because our HRA director tells me that there are funds allocated by the legislature in 2021 that they still haven't figured out how to get those out to communities in Minnesota. So I'm not terribly hopeful of anything happening quickly. By contrast, local housing trust fund, which we have approved here at the board, will allow us to at least do some, if nothing else, neighborhood type of improvements. So for example, if someone has a home that they're renting out that's fallen into disrepair, they can apply for some loan and or grant dollars to fix that up. Something else that I think Kelsey alluded to is that we have a partner who is willing to match a portion of whatever it is that we put in, and that would be the city of Wilmer. I would recommend that we move today on the $300,000 allocation for housing and allocate that to the Housing Trust Fund, and if we do that, that counts the same thing as, because we're putting it in the Housing Trust Fund. That's basically the same thing as saying those are spent funds, correct?
Correct.
Yeah.
'Cause those-
Because we have to have funds spent by the end of 2026. We have to have them allocated by the end of next year.
Where they would show up spent, and I have Karen Anderson here, our CFO, where they would show up spent is when the Candioi County HRA would receive those funds, then we classify those as spent. Once they come up, they release from our bank account.
And the state aid funding referenced in here, the 122,693, that is a separate pot of money that the county is receiving, and it's your recommendation that that would go into the Housing Trust Fund as well, yes?
That could be, yep.
Okay, well, I don't want to put words in your mouth.
No, I would. I would recommend moving those dollars into the Housing Trust Fund. I think that's a good use of them. I think that would then lower our ARP amount. It wouldn't be, unless you would want to do that full 300,000 on top of the 122.
That would
Okay.
be my intention.
Mr.
Okay.
Chair.
Commissioner Berg?
Yes, my understanding, we're just really looking at trying to identify some individual things now instead of voting officially on this, but to give you some guidance and directions to go. And I think that is in there. And just like Prairie Lakes Youth Program, I just mentioned, these are the reasons this is there, and we can deal with this. I think this can wait. Unless we start making formal motions, I will go back and make a motion for more money too. So I think we save this, and it's well noted.
I would agree with that we don't try to make these decisions today because we have opportunities that have yet to be identified. As I said earlier, staff has probably got somewhat might be quite modest ideas to come that could utilize the remaining dollars. But I guess I recognize that we've talked about these numbers a long time ago, and though I'm not ready to move on them today, I'm fairly well committed to them unless something changes. And that's the part that is the unknown, because I don't want to spend money now that keeps us from receiving a grant later. And sometimes that can happen if you put the cart in front of the horse. But Commissioner Anderson?
Yeah, and then as far as remaining dollars, I'd like to push for broadband. I would like to have, if we could go maybe back to the broadband committee and ask if there's any recommendation for, or more of an ask that they might have for more dollars, if that's possible. That's just my request, I guess.
Mr. Chair.
Yes, go ahead.
Thank you. Yes, I agree with you. And I think we did make broadband a priority. We did allocate, how much was it? About 75%?
Correct.
Of the dollars towards broadband with the idea, let's look at that again. And the question is, can we spend all that in this time frame? And so this is, we're looking at dollars that we couldn't possibly spend, how we could use them in a better way. I agree with what you're saying, Commissioner.
All right, so the only one we haven't heard from yet is Commissioner Dale Anderson, and I'll give
Well-
you that opportunity now.
I mean, I'm just thinking of a lot of different things that it could be used for, and I don't know if what I'm thinking in my head is something that would be, fits exactly. But I look at, you talked about our parks in our community, and I've had people ask, could we do things for putting more, playground equipment in our parks and make it more usable friendly for something like that. So that's where my head's been, listening to the conversation. We do have an issue at Candy Park East, and, we maybe could use some money and some help with that. That's where my head was, and I guess that's my thought, is that would be something that would be able to be used by a huge group of people, and maybe that was just something that would be a way to go.
Thank you.
Mr. Chair.
Go ahead.
Yeah, and we're looking at, there's still $380,000 to look at as well. And
Yep.
so those are options to look at down the road. Shortly down the road.
Commissioner Gardner, and then I think we might want to move on here. We have another resolution, or a couple more presentations.
Thank you, Mr. Chair. I do want to caution my friends on the board that we have other entities who wish to partner with us in certain areas. I don't want us to be wishy-washy on this issue of dollars for housing. This is not a huge request compared to the other areas that we have committed to funding in the past. And I don't want to see this opportunity go askance. It's just not going to be a good look for us if we tell these partners, oh, sorry, we're not going to put anything into this housing trust fund that we took the time to create. So I will abide by what appears to be a majority of the sentiment at this time, that we will take this for information only. But I do want us to commit to, at some point in time, what we talked about in the past, which was funding out of ARPA dollars, money for housing within Candiota County. It's not a lot, but we've got to start somewhere.
Duly noted. Thank you. I am going to ask you to wrap this conversation up if you have any closing comments.
I don't have any further comments.
All right, thank you. All right, does anybody need a break before we?
Yes, sir.
Sure.
Okay, we'll take 5 minutes. Sorry, folks. 5-minute recess. We'll reconvene the Kaneohe County Board of Commissioners meeting. Next up on our agenda is the Planning Commission recommendation from the recent Planning and Zoning meeting. And I just want to make a comment before Eric, go ahead and make your way up there. And by the way, when you're done with that thing, I might have a use for it, just so you know. But this is not a public hearing today. The public hearing was at the Planning and Zoning meeting. So we won't be taking public comment. If the presenter, staff person Eric Van Dyken, our county zoning administrator, has questions, he can address those questions to someone, but we're not taking public testimony. So, Mr. Van Dyken, please proceed.
Thank you, Mr. Chair, members of the board. Eric Van Dyken, County Zoning Administrator, here with a single recommendation from our Planning Commission meeting of October 9th. The Planning Commission held a hearing on a request by Travis Stratman on property located in sections 23 and 24 of New London Township for a storage rental facility. The Planning Commission had what I would consider to be a pretty significant evening of testimony. There was a lot of public interest in the project. The Planning Commission, at the conclusion of their consideration, did make a recommendation of denial on the request. The Planning Commission referenced some reasons for that. They are contained in the minutes there. They are not commensurate with your, typically we would see a 1 through 8 on the findings, and that's typical for a finding of granting. The ordinance specifically says that all those findings must be met in order to grant. On a denial recommendation, you may notice that we don't necessarily go through every single one of those, but the reasons or the findings that are stated do need to have a bearing with one or more of those particular finding categories. So you may recommend a denial or reach a conclusion of denial based on one of the standards not being met, and the other ones could theoretically not be addressed at all, because that could be sufficient reason if it was developed and found its basis in the record. So in my recommendation to the county board, I did include a little bit of encouragement that the board may want to look at those stated reasons and consider whether or not they find them to be complete enough to support that decision. Clearly, we want all decisions to be of such a nature that they're well supported and that they would, they stand up to scrutiny. And I always encourage the Planning Commission to make those findings. Sometimes in the moment, we might look back and say those could have been perhaps fleshed out a little bit more, and the board can take that under consideration, I believe, as you think about how you would choose to act on this. And I won't belabor that anymore, but I would open myself up to any questions if I've not been very clear.
Any questions for zoning administrator Van Dyken? Commissioner Gardner.
Thank you, Mr. Chair. Eric, thank you for bringing this before us today. And thank you also for the clarification and the conversation that we had yesterday. My concern, and I have some experience in 6 years having served on the City of Wilmer Planning Commission, so I have a little bit of an idea how these things ideally should work. But my concern is that the motion as currently written is not fully developed nor sufficient to support the denial. And I would say that it should be the duty of the Planning Commission to provide that to the county board. They're the ones who held the public hearing. They're the ones who took the testimony. They're the ones who went out, some of them as part of the viewing committee. And they are the folks who most directly knew what they wanted to do with this motion. But my concern is that as written, without referencing at least one of those findings, and stating the reason why within those findings they're recommending the denial, that, and I would potentially defer to yourself and/or the county attorney as well on this, would it be, as it stands right now, legally defensible in court?
That sounds like a legal question.
Mr. Chair?
Go ahead, Commissioner
Yes,
Berg.
I have a question for Mr. Baker. And my question, if I made a motion to accept the report that they do not approve this request from the planning committee, would that be significant enough based on the information that we received?
A number of things there. First of all, it's accepting what's been given. That would raise the question, what has that been?
Yeah.
Without articulating what that is.
So,
I mean, I'm looking over at the minutes, as Van Dyken said, there are some state reasons or what, property values, and there are other things in there too, but what's the decision based on would be unclear. I think that's where Commissioner
coming
Gardner's
from?
going, is for clarity on that, not a rejection or approval at this time. We want to know what our basis for any decision we make would be.
And if I may?
Go ahead.
Thank you. To take that one step further, anything that is the basis upon which we state here needs to be supported by the testimony in the record, yes?
Yes.
Okay. So if it's stated in the record, for example, that property valuations were not proven, in fact, potentially quite the opposite, to be negatively affected, that could be a basis for overturning a decision in court, yes?
A party can challenge what the basis for any findings were. It'd be generally an arbitrary and capricious standard for that review.
And that's the danger in something this generic. So if they're going to bring this recommendation to us, I would like to see it more fully vetted, more fully developed, so that it does become sufficient, should the need take place, to support a denial, if the party wishes to challenge it legally moving forward. Let's dot the i's and cross the t's on this. And my thinking is, frankly, that this should go back to the Planning Commission for them to fully flesh this out. I don't like the idea of us substituting our judgment for theirs, because I don't want to lose anything in translation. And we typically want to honor the decisions of a planning commission because they are the ones who have spent the most time on this. So that would be my recommendation, and I will support that with a motion to move this back to the planning commission. And Eric, you might want to address the 60-day rule as it pertains to that. But I will move to send this back to the planning commission for further vetting.
So there's a motion on the floor to refer this back to this motion back to the conditional use application back to the Planning and Zoning Commission. Do I hear a second?
I'll second it just for discussion.
There's a second. I'll open the floor up for discussion. And Mr. Van Dyken, perhaps it would be helpful if you put the motion by Mr. Haldane up for the camera.
I don't know if it's.
I'll point to it here, and if the chair would like, I can read how that is recorded in the minutes there. I'll note here, Haldane made a motion, second by Nissen, to deny the request based on the concern of property valuations, consistency with the comprehensive plan, and impacts to the wildlife in the area. And there was discussion in that motion, passed on a roll call vote. Mr. Chair, if I may add, I would want us to be explicit on the ask for the planning commission for a couple reasons. So that they can take their directive, and staff can also help them with that directive in an orderly way. But it would also make a difference how they were being asked to think about this. So, and I'll make this differentiation. If in any way, shape, or form, the board is asking for a reconsideration or an opening of the record, that would require us to enter again into a public process of consideration. So in other words, we would have to reschedule a public hearing and go through that process. Otherwise, the record on the matter is closed. If it is the wish of the board here that with the record closed, the planning commission do a better job of elucidating their reasons and their findings based on the established record, then that can be done without public hearing again. So the processes being fairly different, I think we'll just want to be very explicit on that question.
Thank you, Mr. Van Dyke. And so my understanding of this then is that the motion is perhaps a little overly broad, just to send it back to the planning and zoning? Does it need to be more specific whether, as you just got done saying, do we need to open it up for public hearing again, or is there just that explanation of why the planning commission turned it down?
Yeah, I'll be quite honest with you, I can't quite remember the motion maker's entire motion. I was understanding that he was working toward that. I was just wanting us to make sure that as it gets discussed here, that we be very explicit about it one way or the other. So
Explicit about?
Explicit about what the goal is for the planning commission. If it's just to give better explanation of their motion as it stands based on and drawing from the record as it is established, or whether or not you're asking for, basically a broad remand, which would be, hey, go back and try again in a general sense. That would likely involve opening the record.
Okay.
Steve's got an issue.
Commissioner Gardner.
Thank you, Mr. Chair. Eric, thank you for putting those two options out there. It is not my intent to have this open back up for a public hearing. What my intent in making this motion is to ensure that if this is what the Planning Commission wants to recommend, that they flesh all of that out, that they're explicit in the specific reasons for denial, so that if this board ultimately does adopt that recommendation, and any other interested parties want to challenge that, they would have to do so likely in court. I want to make sure that that's defensible. That's the intent of my motion.
Mr. Chair? Thank you. I'd like to call on Mr. Baker again. Am I hearing you say that there is nothing in here that we could make a motion on and use as a finding or a cause for it that would make it legal? I mean, can we, as a motion be made?
I guess I wouldn't want to.
Because there's several areas talked about, property values, impact on the runoff, the water, the wildlife, a poorly site plan, so forth, and several other things about it. None of those would meet the criteria to meet a motion for a negative.
Well, I don't have enough information behind what was discussed to know whether those are sufficient or not.
You don't have this.
Mine is more just saying, if you don't articulate something, then your decision
Right.
is hard to know what it was based on.
My question is then, of the information that you have as well, you're saying you can't make a decision or advice on that if any of those points would justify a negative.
May I?
Well, you haven't
Right,
answered.
I mean, there are stated reasons. Whether those reasons are good enough is the question. It's different if you don't state a reason at all. And that's more Commissioner Gardner's point, is he's wanting clarity on what's the basis for the planning commission's decision.
Okay.
So, Commissioner Gardner.
Thank you. So if we look at our packet on page 137, it lists the 8 criteria that the Planning Commission uses to recommend. And if they're going to recommend, as I understand, Eric, all 8 of these findings need to be met in order to recommend an approval. If you are going to make a denial, you need to cite using whichever of these findings are necessary to support the denial. That's what I'm asking them to go back and do. It's just simply due diligence as much as anything else.
Mr. Chair.
Go ahead.
And Mr. Baker as well, and Mr. Van Dyken as well, too. This was presented to us with this information and recommended to us. And what I understand, I don't think everyone is so clear-cut that, yes, there might be some aspect of a finding or whatever, but the recommendation comes to us to make a final decision on those. So if we see something that is legal and we make a recommendation in one direction based on what was part of the minutes, do we not have that authority to make that decision? Or do we have to have the Planning Commission totally be in support of this with all their information?
No, the board could also go with a choice to accept the planning commission. They would articulate what their basis for that decision is, highlighting at least one of those 8 reasons.
At least,
You could do that too. Of course, right now, procedure, the motion on the table is to send it back. So that has to be addressed procedurally.
exactly, but I'm just, so if it was
Yeah,
sent,
both options are available.
so we could make a decision to deny it. If,
Yes.
and the problem is, how do we word that motion? I'm no expert on this. That's
So-
why I'm calling on you.
Let's keep our discussion to the motion that's on the floor.
Okay,
So right now, we have a motion on the floor to send this back to planning and zoning. We have a second. Any other questions?
I guess I want to ask Eric. I mean, I understand what you're saying and I understand what everybody else is saying, but which one of the 8 would be our reason for denying it? I guess I was reading through them again now and I'm just not seeing in them 8 where it says we should deny it. And you said that when you started, and that's I think where Steve's going, but is there one that you can, that we can say this is the one that is the reason we deny it?
Before you do that, could you put those on the screen?
good.
The findings?
Yeah.
The criteria.
Okay, well, I don't have them in a raw form. I guess I don't have my ordinance with me. I have the original staff report that has draft findings addressing each area. Now, the conclusions of those are different because the recommendation was different than what the Planning Commission did, but we can certainly talk about those. I would say this, Commissioner Anderson, thank you for your question. The Planning Commission vote I think we can reasonably conclude which findings they are addressing. Number one, we see that Haldane made a motion, and his first statement is a concern of property valuations. Now, my concern would be that's not very well developed and has actually some basis in the record that contradicts that. But that aside, if we look at finding number one has to do with being injurious to use and enjoyment of property in immediate vicinity and the potential to substantially diminish and impair property values. So I would say clearly, Commissioner Haldane, Planning Commissioner Haldane, was intending to address finding number one, and I think the courts would clearly accept that even without explicitly stating that, because it goes to the content of that finding. The impacts to wildlife, I would say, would be a challenge to place that in a specific category, and that might be the least specific and the least weighty of any of the concerns given. And then the comprehensive plan concerns do relate specifically to finding number 6 here, and I would just note that has to do specifically with consistency with the comprehensive plan. So perhaps even more than the idea of which findings do they relate to is the idea of developing a little bit more, how might it be inconsistent with a comprehensive plan, and how do you reach the conclusion that property values will be negatively impacted with support from the record? That's, I think, the areas that perhaps Commissioner Gardner is saying, if we make this decision right now, there are reasons. Are they the types of reasons with the record as it is that if we were to receive a challenge would stand up well? And without being too pejorative, it was my hint that I didn't have great confidence in how they worked out. That was where I was urging the board, if they went with that recommendation, you could flesh that some out yourselves. What I hear Commissioner Gardner is saying is he honors the work, he honors the Planning Commission, and would love to see them first try to work that out a little bit more as they've had a chance to reflect within the record.
Thank you.
Thank you. So, as a person who sits on the planning and zoning, that consistency with the comprehensive plan is where I had the most heartburn. And particularly as there was an area that was addressed by many of the zoning administrative commission regarding runoff and stormwater management, with a lot of land that would be altered and a lot of impervious surface. But that's not our role here today, is to add those and try to put it in the mind of the Planning and Zoning Commission. So I can't support the motion as it stands by simply sending it back to Planning and Zoning. I could support fleshing out those reasons for denying it under the meeting the comprehensive plan, the ideals of a comprehensive plan.
Clarification, Mr. Chair. It's my understanding that was the motion. Perhaps I'm misunderstanding either the motion maker or the body.
It is, if I may. I simply believe that the Planning Commission is the appropriate body to fully vet that and flesh that out. That's all I'm asking, is that they go back and finish what they started and bring back to us something that is going to be legally acceptable.
What I'm trying to distinguish here is what you talked about earlier, whether starting over or just fleshing that out. Because I think as it was.
I've made it clear I'm not
maybe need
starting
to-
over.
Okay, maybe we need to have the motion read back so that we. And then Dwayne Anderson, you'll be next.
Gardner motion to send this planning commission recommendation back to the planning commission for further vetting.
Pretty broad, but if that's the intent, is to clarify the reason for the motion to deny, then I can support it.
I like what you just said, clarifying the reason for the motion
Commissioner
to
Anderson.
deny.
Yep, that was how I understood it, that Commissioner Gardner wants it sent back for clarity, to be more specific on what conditions and findings that they use to deny this application.
Okay, any other questions or comments? Then I will call the question. All in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
So, yes, you probably anticipated my question, when this would take
Yes.
place. We have a really,
Yes.
really long anticipated planning and zoning meeting at the next session. But I think perhaps in fairness to everybody, we should probably deal with this as quick as we can as well.
Well, yeah, Mr. Chair, thank
I'm
you.
open
And Commissioner Gardner alluded to this just a bit ago, and I failed to immediately respond to him on 60-day rule. The 60-day rule will be up in mid-November, and not probably in time for us to go to that planning commission and subsequent to the board without extending the 60-day rule. The statute does allow us to extend that by simply stating, making notice of that and stating the reason for up to an additional 60 days. So it would be my recommendation that one of two things would happen, that I would take this back to the planning commission in December, which would be more around a 90-day decision time by the time we get mid-December. Or the only other alternative that I would recommend would probably be, which we don't do very often, a special meeting of the planning commission, because I would ask us not to put it on the regular November meeting, as we have a substantial discussion that we anticipate there, and I'm not sure it would be fair to the public or the planning commission to load that evening in such a way that we're there at a time that maybe isn't productive for people.
And I would add that I want to make sure that all the planning and zoning commissioners can be present at that meeting. So if we call a special meeting, and I know we have one pilot who flies internationally, if he, for example, couldn't be there, I don't want to see that happen either. So December, it sounds like December or a special meeting, we'll wait to hear from you on it. But I agree, the November meeting is probably not the right time to address this.
And Eric, just for everybody who's here today and for those who are listening, can you explain the intent of the 60-day rule and why it's important to make a decision within either that 60 or 120-day timeframe?
You bet. Thank you, Commissioner Gardner. The 60-day rule it's essentially a timeliness statute, and it says that as a decision-making entity, permitting authorities have to act on requests within a timely manner, and it defines that essentially as 60 days, saying you have to give a final answer. The check and the trick on that is if you fail to do that properly, you will essentially you will automatically by default have issued the permit. So if we were to not follow procedure properly and we miss that, that is issued, and it's issued without any conditions, et cetera. So it's an important thing for us to be mindful of and watching.
And we can have the 160-day extension, but we have to, then that's it. If we don't act within that 60 or 120 days, whichever it is, then the application is automatically approved.
That is correct.
Sure. So that's why the time.
I don't think we
frame
have
is
a
important.
concern about not being able to act within the extensions. But how does that, do we have to move on an extension, or do you do that from your department?
We will do it from our department. We'll submit to the applicant and the landowner, who are essentially kind of co-applicants in a way. We will notify them both in writing of the extension and the reason for the extension.
Okay, very good. Any further questions or comments for Mr. Van Dyken? Then I'd like to thank you, Eric, for your hard work and your explanation and the process, going through this process, and thank everybody of interest that's been here today, and more to come, as they say. Thank you.
Thank you.
Thanks, Eric.
All right, next up on our agenda is the Dawn Struck nuisance abatement hearing. Is Mr. Garrett there? He is.
There it is.
Sneaks in the side. Pardon me? Sneaks in the side.
Good morning.
Good morning. Thank you, Mr. Chairman. Yes, Gary Gear, Environmental Services Director, here this morning before you with the Donald Struck nuisance abatement hearing. The first.
Excuse me just a minute. Could we?
Get out. Just give him a minute.
Yeah, we'll give you a minute to.
Yep.
All right, go ahead, Gary.
All right.
Could you take your conversations outside, please? Thank you.
All right, thank you, Mr. Chairman. Again, Gary Gear, Candido County Environmental Services Director here this morning with a nuisance abatement hearing for the Donald Struck property located at 20815 89th Street Northeast in New London, Minnesota. The first letter went out in August 15th, recommending or requesting a September 15th abatement timeframe. On September 18th, I went to the property and nothing had been completed and no contact had been made to the office. So a letter was sent out notifying the property owner of today's hearing date and time. And as of at the end of last week, still nothing had been done with the property. So it would be staff's recommendation that the county move forward and abate the nuisance with any fees associated with that being assessed to the property as a special assessment as the nuisance ordinance provides.
You've heard the recommendation regarding the nuisance abatement. How do you wish to proceed? The chair would make the motion that we accept staff recommendation and proceed with the abatement.
Commissioner Berg will second that motion.
So there's a motion and a second to abate the nuisance complaint. Any discussion? Commissioner
I
Dale?
guess, Gary, just from the pictures, what, other than siding in the houses and a little bit distance repair, what other things are around? I mean, I don't see a lot of clutter other than that one picture. I just was curious what was all kind of involved.
There's not a lot. It's basically an abandoned property. It's not been mowed or maintained for years. The first photo, I don't know if you have that up or not. If you need to look close with the shadows, but there's probably about a 6 foot by 8 foot hole in the roof as well.
Yep.
So and then on photo number 2, there was a complete gable roof there that's fully collapsed and is open to the interior, as well. So it, while on one hand it looks like, boy, it's standing there, when you walk around it, it's certainly in a
tough
state of disrepair.
Okay, no, that's why I was asking.
Correct.
And Mr. Greer, has there been any movement by the owner to abate any of these?
There has not.
Have you heard from him?
Yeah, I haven't, and that makes me a little uncomfortable coming before you this morning. I have not, but I did, the last notice, or the last letter went to him, certified mail return receipt, and he did sign for it and knows what's happening. So
And when did that happen?
he accepted that letter September 21st.
So,
just about a month ago.
yeah, and he fully understands the next step if he didn't abate, or why did you say you feel a little uncomfortable?
Well, just because I haven't spoken with him face to face.
Okay.
You like to have some kind of contact, but in this case, that just hasn't happened.
And do you have a number to reach him? Have you had him?
I do not, so
Okay,
that's
and
why
he has
I've been-
not reached out to you?
Correct.
Okay. Any other questions or comments? Then I will call the question. There's a motion on the floor and a second to abate the nuisance of the Don Struck property as indicated in the minutes. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Thank you, Mr. Chairman.
Mr. Chairman, may I just add a comment if I?
Yeah, go ahead.
Okay, this is for Mr. Gear. Yeah, I want to say congratulations on your major run. If you don't mind me suggesting or bringing up some personal information.
Yeah.
You ran how far and where and what kind of temperature? Your race, it was a race.
Well, it actually isn't, it wasn't an organized race.
Okay.
But because it's not permittable.
Oh, sure.
I ran a double crossing of the Grand Canyon last week. So it was 44 miles and, which the distance isn't real terrible, but the 22,000 feet of elevation gain and loss was kind of melted my legs. So, and it was, the bottom of the canyon was still 100 degrees. So it messes with your head.
So you
after a
went
while.
down one side and up the other?
Yep, and then back again. Yeah.
I suppose, they always say if you do the Grand Canyon and you hurt yourself, you're SOL.
Yeah,
It
well,
costs a lot of money to fly you out of there.
I had some issues too.
Uh-oh.
No blisters or anything?
No, but just I had significant, I don't know, I'm on TV here. I had significant cramping and so.
Oh, I
and I was
bet.
short of electrolytes and stuff.
Oh.
And I just, the last 6 miles are all, it's 6,000 feet straight up. It isn't a hill, it's just a wall, you know, and you just switch back up and.
My question is, how do you train for that? But what an example, and actually it says something about you, being able to focus and problem-solving obstacles along the way and long-term planning and adjust the thing. So, well done.
Yeah,
And I'm
thank you
glad
very
you're
much.
back
All
and
right.
well.
I think he's trying to back out of here. Thank you.
That's one runner to another, yeah.
All right. You're making the rest of us feel bad here, Courtney. So I think that brings us to the end of our scheduled agenda. We now have our report outs, and so I think we'll start with, I don't know, let's start with Dwayne today if you're ready. If you're not ready, are you ready, Corky?
Sure.
Dwayne is writing it, so go ahead, Corky.
Oh, okay. I'll just make it really quick. We had a CCT meeting, and I bet Dwayne's taking some notes, and I won't take everything there. But one of the good news is, actually, we've had buses on order forever because of COVID, and they're starting to come through now. And we got 3 buses, and 2 are going to Litchfield, and 1 is to Wilmer. And I'll try to leave something. That was a really good thing moving forward. The other things, I attended the Community Corrections Conference, and Tammy Jo Liburg isn't here, but she got recognized there as well as her group for the legislation and getting that all passed and what was accomplished at that meeting. Prior to that, we had a Community Corrections Advisory Committee meeting on last Tuesday, and at that meeting, we really got a picture of what it's like to be an employee going out in the field, being a probation officer and dealing with parole people and so forth. It was a very informing meeting, what they have to go through. We had the 18 County Mental Health Consortium meeting, and we had a good turnout for that. We were missing some county commissioners. This is the annual meeting that we, as elected officials, that we make some votes and make some decisions. And each county has 1 vote. So some of the counties were represented by their representative they have appointed to that. And most often that's a Health and Human Services person, or it would be there voting on that behalf. There was a motion that went forward, and we're just going to, there's been more questions brought up, I understand, but that each county, and I mentioned it's at the last meeting that this could be a possibility, that each county would put in $20,000 that they would be their money they get back if it ever closed down, or out of the assets, the money for the 18 County Mental Health Consortium to help cash flow, because DHS in the last couple of years have changed some of their funding mechanism on grants, and we operate mainly off grants, and that we are not able to get reimbursement after the first of the year like we want to. And so we have this major cash flow, and I'm going to make that simple. It did pass, or 1 county objected to that, and it's my understanding, but I don't think that county, the objection, I think, was more based on, gee, we're helping DHS out, but we still want to work with DHS to solve that problem, and we can solve that problem and change it and go back later. But something came up, and we're going to just, I'm not going to ask the board to vote on that at this point to see how it comes out. There's a concern that some of the counties want it based on population. So we'll see how that, and I wish that person would have been at the board meeting. So anyway, that's pretty much summed everything up. So, thank you.
All right, Dwayne, we'll go with you next.
Okay. Yep, so in the last couple weeks since our last county board meeting, I just had 3 meetings. One was the park managers meeting. Those meetings are interesting. We have 5 parks, and you have 5 differing views on how the parks should be run, and yet at the same time we try to make everything uniform so that everybody has to follow the same rules, and that gets very difficult to come to kind of a consensus on how things are. But we are working on things continually. We try to listen to them, but then we try to do what's good for the public as well. So, yeah, so we are keeping the rates the same, and then for next year. And then I think we decided we were going to have a second meeting next spring before everything kind of gets going and the parks get real busy, just to kind of see what, if there's anything we need to tweak as far as like, I don't know, I guess reservations was kind of one of our big issues. Right now, we do a week at a time, but then some of the parks, they would like to be able to shorten it up and do online reservations, maybe 3 days at a time. So, and there were people, some parks don't want to do that. They want to have it a week at a time and just leave it at that. So anyways, that was that meeting, just kind of ongoing type of discussions with how to manage the parks. Then on the 10th, I had a veterans meeting with, it would be with Trish Appledorn, and then it's Annabeth. And that's always kind of fun to see some of the veterans there that show up for the meetings. And we did have a discussion, I don't know if they brought it up to you, but about per diem. I think they're at $35 per diem, and I said I think it should be a little higher than that. It should be brought up a little more what the rest of the county is paying. And then they weren't sure how to go about that, if it has to be approved by the county or what. So that'll be an ongoing discussion, I'm sure, but hopefully we can resolve that soon. I think the veterans that take the time to show up to those meetings, I think they deserve to get compensated a little more for their time that they put in to show up for those meetings. And I was going to say, Veterans Day, there's a lot of things for people that are veterans. There's breakfast, you're going to be stuffed if you go to everything. So there's a lot of activities. I thought they should kind of spread some of those things out over a week or something so that they could maybe attend more of them or whatever, because there's a lot of breakfasts and meals and stuff that are going on Veterans Day. The 13th, then I did the CCT meeting, which is Community Transit, with Corky Berg, and then it'd be Renville County as well, and Meeker County. We do have 7, I think, that are going to be coming, 7 new buses that hopefully will be coming next year. The builders, they receive a chassis, and in the past what's happened is the chassis weren't coming when they needed them. And then when they did get some, they were having a hard time getting parts to build, finalize the buses. But they are now going to be getting, or they are getting 44 a month, and they're able to build out 50 is kind of their capacity, what they can do per month. So they should be able to provide everybody the buses that they need that are back ordered as far back as 2020. And so as far as the condition of our buses in the system, usually our ideal trade is at about 150,000 miles, and there's getting to be several now that are at 300,000 mile mark. And what's happening is they're having issues with the buses rusting out, and so now they're having to do some body work on them, which is costing a little bit of money. And usually it's the steps leading into the bus that rust out, and that's where the issues are showing up the most, I guess. So that was basically all my meetings. And so.
Thank you, Commissioner Anderson. Commissioner Anderson.
Yes, I listened in on the Prime West meeting on the 5th of October. That's a hard thing for me because I have another meeting I'm driving home from, so I can only listen in on the phone. So Corky is there to do all the business part of it, but it's still fun to listen in and get kind of stay up on that. Yeah, go ahead.
Are you going to expand?
No, you expand on
Oh, yeah, I forgot to mention that.
I knew that's what you were saying when you...
Yeah, it was a big meeting, and they actually talked about the grants, reinvestment in the community with the money that they brought in that was available for that. And we have to put the money back in, and really, it's got to be targeted to people on the county and the state programs, rather, not the county, but the state programs that we administer. So they went over who got the grants, and I think they want to do their own media thing for all the counties, but I would, if you want information, I guess contact them. But it looked like Candioi County came out quite well, as Ashley from Woodland Centers, they got, I think it was close to a $300,000 grant as well. So we came out very well in providing some extra services here to get people, improve their quality of life and get them back to work and so forth, so.
I knew that's a quirky guy. I heard him gasp over here, so I knew that's what he had forgotten. I went to the Middle Fork Crow River meeting on last Wednesday. That's always an interesting meeting. They've got always something going, and always they're trying to look at different ways to do water quality. The big thing they're working on now is the smell in New London when the mill pond rolls over. And they're looking at a big project for that, if they can get the money and the funding for it, to try and eliminate that, because it actually is a gas that's really not a healthy gas that gets produced when that does do that. So that's kind of their big thing now. They're trying to figure out how they're going to do that. It would be one of the things that they were looking at. It's basically injecting air into the water to make that not happen. And it's like a big floating barge that they're going to have to set out there to handle that, and it would run year round. So it would have a huge electric load. And there would be 2 different spots that they would put that system in to try and control some of that gas production that seems to do every single year. So that was really interesting. And then the other meeting I had was Prairie Woods last night. We went through their budget, and the 3 things that are kind of extra than the budget are the Greater Minnesota Regional Parks and Trails, and the outdoor school for all. It's a thing that they're trying to do for the whole state of Minnesota, so that right now there's 5 different parks, or 5 different groups that are in that coalition, and they're looking for a bill to be passed to try and get funding for that. And the other thing that they're looking at that's going to be a huge thing that they're trying to work on is a environmental education preschool. So that's the other thing that they're doing a lot of research on to see if they can get accomplished. But a lot of things that are moving and shaking, I think, at Prairie Woods, and it's becoming a lot bigger place than what it used to be. So them are the ones that I was at this week. I will say I feel bad I wasn't able to go with these guys to Tammy Joe's thing. I had a weird thing happen at the people we feed pigs for, so that's why I had to back out. So.
All right, thank you. Commissioner Gardner.
Thank you, Mr. Chair. Briefly participated along with Administrator Baker in the Housing Trust meeting held at the Community Foundation offices. Received some information, had some nice discussion within that. I was unable to attend the EDC Joint Operations Board meeting as our liaison. I was out of town that day. Participated in my first AMC Board of Directors meeting last Friday along with Commissioner Imdet. Participated in negotiations yesterday with our corrections bargaining unit. Intergovernmental meeting this afternoon with the City of Wilmer and Wilmer School District. Also on tap will be Woodland Centers Board this Thursday, and at the end of the month, towards the end of the month, our AMC district meeting. I did want to ask my peers who serve on the Joint Ops Board for EDC. I'm not finding a meeting this month on my calendar, but I think that's a mistake. If offline you can help me with that, that would be great. Otherwise, that's all.
Joint Ops or Joint Powers?
Joint Powers.
I thought I saw it in November, but
Then I'm not missing anything.
I could be wrong, but
I'll double check. Thank you.
you want to go next? Do you have anything to update us on?
Maybe just, unless you were gonna talk about the building committee?
Yeah, go ahead. You
Oh,
take.
okay. So last week, we had a building, I'm like, when was that? Last week, we had a building committee meeting, which is our facilities director, Andy Thorson, myself, Commissioner Imdyke, and then Commissioner Dale Anderson. And then we have Barbara Marks with Engen and Associates, and we are we're trying to figure out a phased approach to all of our building needs, but coming back to Health and Human Services, we're looking at not, if we were to do everything that we would like to do, it would be a very high cost. And so we're trying to look at it more of a phased approach, lower dollar amounts, and like I said, a phased approach. So at the November 7th meeting, Barbara will be here to present kind of a high-level overview of what our goals are moving forward, what are the guidelines that we're looking at on the building committee, and some of our guiding principles on how we are coming up with these decisions and recommendations to the full board. And some maybe low-hanging fruit that is probably more maintenance needs than building committee needs, that we can just move forward, but keeping the board in the loop on that. Did I miss anything?
No, well, I just to tag on to that a little bit as I segue into my report is, you know, just like our homes, they're 25 years old and you walk in every day and you don't really notice that the paint might be peeling a little bit here and shingles starting to loosen up there. And if you walk around and take a critical look here, especially in the public places, you'll see wallpaper that is peeling and starting to hang a little bit. And some of it's just dated and most of us wouldn't go 25 years without some sort of updates aesthetically, at least of our homes. So it's worth the look, and I look forward to Barbara kind of presenting a big picture look here. So thank you for, one of the things that and maybe it's personal for me, but you may have heard of me before, but I think as part of this whole study is we ought to take a serious look at the opportunities for solar. The Inflation Reduction Act, I think it was, allows the county to get a refund of 30% of the cost of installing solar, which is a game changer. If it's going to make sense without the 30%, it'll make a lot more sense with the 30%. And so there's a organization called the Clean Energy Resource Team, CERTS, who Judge John Lindstrom, some people you know him, live on Lake Andrew. His son runs that organization, and they have resources available to help you do a study to see whether or not it makes any sense. Anyway, on the 9th, we had the planning and zoning meeting that we talked about quite a bit today. On the 10th, we had the KCC Community Corrections Community Advisory Board, and then later that evening, I had my all-important meeting at the Paynesville Airport. They fly over some of our airspace, so we get invited to their once-a-year meeting. Not much happened over there. We had on the 7th and the 11th, went up to the MACAC conference, which it was a very good conference. I've never gone to that conference without learning something new and more initiatives in dealing with that that social issue that we have with corrections. And while I was there, I was on a Zoom for a NACO committee that I'm on, and then there was a town EDA meeting that evening. And then last night, I will just add on to what Dale talked about at the Environmental Learning Center. So same thing that's happening out there, that facility, a lot of it's starting to get old and showing some wear and tear. And there's some very dedicated people on that board out there, especially the executive board that is bringing some sort of high-level ideas to that organization. And we had a part of that being, if they get designated a regional park, that opens up a lot of opportunities for out there. And what Dale was talking about is those 5 parks that are ELCs that have this coalition. Some of you have heard of the Wolf Ridge Learning Center up in the North Shore. I know New London Spice has been going up there for years and years and years. That's something that maybe they aspire to a little bit, to having some sort of overnight opportunities for students to come in. Not that they want to build something, but you could work with Shores, Lake Andrew or some other local facility for housing and create those overnight opportunities. So just a lot of ideas being tossed about and a lot of dedication out there. So that kind of does it for me, but let's quickly go over calendars.
I have one calendar thing I bring up. As you mentioned, you asked about the EDC. I have on my calendar not this Thursday, but next Thursday is the EDC meeting. I think that's a quarterly meeting. So just for information.
All right, thank you for that, I appreciate it.
I don't have, you talking about the 26th?
Yeah.
Well, somebody ought to tell them that if they don't get it on the calendar, I won't be there because something else will come on the
Yeah,
calendar.
you'll probably need a quarter, but, yeah.
So, but we have, fall, district meeting next Friday, week from Friday.
Yep.
At, Dawson, Minnesota. And, what else we got coming up? Of course, our annual conference. Sounds like we're all now registered. Oh, one of the things at the state board meeting that they adopted, not for the 2023 budget, but for the 2024 budget, those of us who are on the state board, AMC has been paying our first night lodging. And the executive board and the finance committee thought, you know, almost every county in the state, every commissioner goes up the night before anyway, because rural counties, rural action, what's that called?
Yeah.
The rural counties.
Minnesota Rural Counties.
Yeah. I want to use,
MRC.
MRC, there you go, thank you. They have their meeting Sunday evening, so they're going to discontinue paying board members first night lodging, and so that'll be on the county, but I guess everybody goes anyway. And what other, I think the dues for the counties are going to go up a little bit, which is understandable. Everybody's cost of doing business is going up, so.
About an average of 5%, if I remember.
Yeah, it's not, everybody will get 5%, some will only go up less than $100, the small counties, but, what else have we got?
Road and bridges.
Road and Bridge on 31st. And, then our annual conference would be before our next board meeting, right? No, that's in December,
We have two meetings
I'm a
in
month ahead.
November, so.
This is going, time's going too
Don't
fast.
push it that fast, Roger.
Take the month off.
I had the
Yeah, 2 meetings.
annual conference on my mind. All right, with that, unless there's anything else, we are adjourned.